It's been challenging in more ways than one, with lots of people still narrating their ordeal.
Coming to terms with this reality was never a stroll in the park.
It's 2020, a year of the pandemic. It was a bolt from the blue. It came quite unawares, like a thief in the night. According to the World Health Organization, the first human case of COVID-19, the disease caused by the novel coronavirus causing COVID-19, subsequently named SARS-CoV-2, were first reported by officials in Wuhan City, China, in December 2019.
While some of the earliest known cases had a link to a wholesale food market in Wuhan, some did not. Many of the initial patients were either store owners, market employees, or regular visitors to this market. It went on to say environmental samples taken from the market in December 2019 tested positive for the SARS-CoV-2, further suggesting that the market in Wuhan City was the source of this outbreak or played a role in the initial amplification of the outbreak. The market was closed on the 1st of January 2020.
Yeah, but amid the denial of its potential danger, it took Dr. Li Wenguan, who later died of the virus, to take the lead of the secret. He announced to the world that China was dealing with a dangerous infectious disease, the coronavirus. But before then, the virus had already begun to cross borders, killing thousands of people in the wake of the spread. By January 2020, nations began to shut their borders and lock down cities. Eventually, entire countries were shut down as the United Nations declared the spread of the virus, the deadly virus, a pandemic, and officially named it COVID-19. While some countries have succeeded in containing the disease's spread, others are now battling to curb its second wave. On February 27th, the NCDC's progression of COVID-19 cases in Nigeria indicate that 2 cases were found in Ogun State, and almost immediately, cases in Lagos surged to the top of the log. The FCT wasn't spared either. Then, other states, including Kano, which at some point overtook Abuja, and then Oyo and Gombe. Incidentally, when Plateau State increased their testing, they surged above Oyo State in a number of confirmed cases. The cases then oscillated from one state to the other. Eventually, the NCDC's confirmed cases in Kogi and Cross River states, the last states to confirm cases.
Let's give you a breakdown of some of the major disruptions due to the coronavirus pandemic. And we're looking at the number of deaths all over the world. Over 1.8 million have died from COVID-19. And we're also looking at some of the top countries that have been worstly affected by the virus. You can see here that the United States is number 1, followed by India. There's also Brazil, Russia, France, and the United Kingdom. About 193 countries are suffering from COVID-19. You can also see below as well that Nigeria have had its fair share, sadly, of deaths. We're looking at 1,278, and these are figures coming in from the Nigeria Center for Disease Control as at last night. Well, we take you to, indeed, the next slide. You can see that medical workers who have been on the front line in the battle against COVID-19 have also been affected, not to mention now that we're hearing of the second wave in many countries and possibly a third wave. Amnesty International found that over 7,000 health workers, and this is into the amber months, indeed, have died around the world after contracting COVID-19. Worst hit as at that time, because these figures have definitely increased since then. It's Mexico, of course, the United States is next. You have India, Brazil, and then in Africa, you have South Africa. Sadly, for a lot of the doctors, medical workers in the United States, a lot of them are immigrants and those referred to as minorities. Now, in Nigeria, the NMA very recently in December said that we have lost 20 health workers due to the coronavirus pandemic. Now, that's not all of the disruptions. There was also loads of sectors affected by COVID-19, and these are just a few: entertainment, construction, aviation, transportation, and education. But perhaps some light at the end of the tunnel, and that is with the speed that the vaccines came on, and we're looking at the Oxford University AstraZeneca, the Moderna, the Pfizer BioNTech, and the effectivity and the storage. Of course, you know that the Sputnik V, that of Russia. We also heard fairly today as well that indeed China has rolled out a vaccine against COVID-19. So all of these are some of the major disruptions that we experienced this year in 2020 due to the coronavirus pandemic. Some have referred to it as perhaps a war or even a national disaster. But the thing with those things are that at least you can relocate or perhaps even build a defense mechanism. But COVID-19, no, it's affected everybody in different parts of the world. Some people would like to forget 2020. I don't know about you. Let's find out from Chamberlain.
Well, the broadcast profession wasn't spared. Ordinarily, this seat here would have been occupied, but the COVID-19 protocols, which gave rise to social distancing measures, kicked in, and so we had to respect all of those. Well, here now is the first press briefing by the Presidential Task Force after the first confirmed case of COVID-19.
Welcome to the first.
It's the first press briefing by the Presidential Task Force on COVID-19 in Abuja since it was inaugurated by President Muhammadu Buhari on March 17 this year.
Chairman of the Presidential Task Force.
Secretary to the Government of the Federation, who is also the chairman of the task force, highlights the government's economic sustainability plans.
Mr. President has today approved the constitution of an Economic Sustainability Committee to be chaired by His Excellency, the Vice President. That Mr. President has also approved the exemption of the financial services sector from restrictions to allow skeletal operations in the financial system and the money market in order to keep the system in light operations during this period.
Next is the Minister of Health, who gives updates about the current status of confirmed cases and how the government is managing the spread of the virus.
Till date, 3 persons have been discharged after successful treatment, but sadly, another fatality was recorded over the weekend in the person of a patient who had severe underlying illnesses. We have intensified contact tracing, and our strategy remains to promptly detect cases, isolate them, and follow up with their contacts.
The minister also highlights what the government is doing to scale up testing and treatment capacity.
The NCDC has expanded its capacity by engaging hundreds of ad hoc staff to support various areas of response, including the call centers, contact tracing, and follow-up of persons of interest. On the order of His Excellency the President, all retired but essential and able-bodied staff are to be recalled to service at this crucial period. In addition, training is being conducted for medical personnel to support overall preparedness and response activities to prevent the virus from spreading further into other states.
How exactly is the government
fielding answers to questions from Channel's reporter on how the government intends to cushion the effects of the total lockdown on citizens? The Minister of Humanitarian Affairs has this to say.
Let me also reiterate here that because of this COVID-19, the vulnerable groups have to be expanded because we are aware that we have people who live on daily wage. And so we're also going to look at those groups of people to see how we can take this food relief intervention to them in these affected areas.
There are currently over 100 cases of COVID-19 across 12 states in Nigeria, with majority of the cases in Lagos and Abuja, just as states across the country enforce a lockdown to prevent further spread of the virus to other parts of the country.
We also have a background of President Muhammadu Buhari's decision and indeed subsequent announcement of the lockdown. Our correspondent Oroluwa Shonibare packaged this report.
We are therefore working to ensure such interstate...
The necessary call by President Muhammadu Buhari to contain the spread of COVID-19.
Based on the advice of the Federal Ministry of Health and the NCDC, I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020. This restriction will also apply to Ogun State due to its close proximity to Lagos and the high traffic between the two states.
At first, it was hard for people to make the adjustment, and obedience to social distancing was widely disregarded. But the daily rise in number of cases, as revealed by the NCDC, set off alarm bells to the reality of the situation. And before long, other states began shutting down places of gatherings and borders. At the end of the first 2 weeks, there was widespread apprehension whether the president would relax the order or extend it. The matter was laid to rest at 7 p.m. on April 13th.
It has become necessary to extend the current restriction of movement in Lagos and Ogun states, as well as the FCT, for another 14 days, effective from 11:59 p.m. on Monday, 13th of April 2020.
Soon enough, rumblings were heard again from pockets and stomachs of people whose means of livelihood became affected by the order.
We are hungry. We are trekking from one place to another.
Protesters demanded palliatives from the government. To them, this was a fair trade for not working. Security threats from hoodlums also spread, raising fears of looming breakdown of law and order. However, this was repelled by not only security agents, but residents who were not ready to give up the little they had without a fight.
Anybody come from anywhere, come from Abuja, come from Kano, just come down here and we bring you down to the lowest level. Am I good? Yeah.
The federal and state governments began distributing palliatives in food and cash to those regarded as vulnerable in the society. But regardless of this, many people still yearn for one thing: freedom of movement. But the rising number of cases and deaths from COVID-19 appears to be the only obstacle in their way. Oroluwa Shonibare, Channels Television News.
Well, joining us now to weigh in, reviewing the year 2020 as it has to do with the effect of COVID on all of us and the health sector. We'll start here in Lagos. We've got Dr. Olufemilayo Akinola, who is a chief psychiatrist heading the Oshodi Annex of the Federal Neuropsychiatric Hospital. Thank you for joining us today.
Thank you very much for having me.
And we also do have joining us via Zoom, Professor Oyewole Tomari, who is a professor of virology. He joins us via Zoom from Ibadan, as you may see there. Prof, thank you for joining us this evening.
It's my pleasure.
Okay, then we also do have Professor Innocent Uja. He is the president of Nigeria Medical Association. So you should see him as well via Zoom, but he's a bit mobile, so just hang on. You will, sooner rather than later. Well, we also do have Professor Isa Sadiq Abubakar, Director, Center for Infectious Diseases Research of the Bayero University in Kano. We've got one more. Millicent.
Indeed, Dr. Chinwe Ochu, leading prevention programs and knowledge management to the NCDC. She joins us from our Abuja studios.
Thank you for having me.
All right, great. Let's begin with you, Dr. Akinola, Chief Consultant Psychiatrist. I mean, 2020 for you, especially when we look at the health sector, what would you say was like the major highlight of 2020?
It was the COVID infection and, of course, the psychological effects, the effect on people,
Healthcare workers. Yeah.
Yes, workers. I mean, the effect was just global. Everything, it affected everything. The health of people, there was increase in rate of depression, anxiety disorders. Of course, people, then the fear. The health workers had the fear of catching the virus, taking it home. And, people didn't want to attend to patients because of the fear. So it was quite, shall I say, inverted commas, an interesting year. Very stressful year, but we hope the second wave won't be that bad. Although they are saying it's going to increase, but we are hoping, we are keeping our fingers crossed.
We're doing the same thing, as a matter of fact. But could you tell us, what was it like for the patients? Because we already know that you have to handle them with care in terms of how different things go on there. So how did they react to this?
Yes, it affected them so many ways. For example, those that already had psychiatric illnesses, because of the lockdown, they couldn't access their healthcare providers. For example, those that live in Badagry, there was no way to come down. There was no way to buy. I had a patient that they couldn't get his anticonvulsant, so he started having breakthrough seizures again, and people couldn't come. I had one from Ota that, it started fighting, almost having going physical with his wife, because he kept on saying he'll be able to buy the medication where he lived, but actually couldn't. So then, of course, those are the people that already had mental illnesses. So, but now, the fear, the anxiety, am I going to get it? That created and there was a lot of increase in depressive states, anxiety states, and it was just unprecedented, and we really had to deal with all that. Then health workers themselves. So coming to the hospital, there was we had to put in a lot of barriers so that, we won't transfer it to the workers won't transfer it to patients. And so it was just a stressful year.
I want to bring in Professor Tomori, who's joining us via Zoom from Ibadan. And that is at the beginning, when what did we know about COVID-19? Looking at how it started in December, January, up to this point, we appear to have learned a lot about the virus, yes?
Yeah, I mean, over the months, the virus kept evolving and coming in different forms, and we're learning on a daily basis. So we had to keep ourselves on track of what was happening in other parts of the world, and learning almost like, it was like a learning curve every day because something else happens. It started in one type of symptoms, and then you learn more about it as time goes on. And I think one of the lucky things for us in our area is that the virus did not behave to type as was known as it was behaving in Europe and the Americas. And I think the virus put history to shame. It was usually assumed that anything coming into Africa was going to cause devastation. But this time, I think they were disappointed to our own happiness.
Well, Prof, I'm just wondering if I could just add to that. I mean, for virologists, first of all the health professionals, it was what a job they did and are still doing, and we all appreciate all of them, not just here, but wherever they are. But for virologists, did they see this as an opportunity for them to perhaps develop certain things? Because I know that, they are in some sort of front line about this one. How did they see it?
Yeah, in other parts of the world where the environment is conducive to good research, it was a great opportunity. Anything like this, which you call obstacles, are actually stepping stones to greater achievement. But that's in areas of the world where they are ready to take advantage of opportunities. We are not here because we have not created the environment for us to make use of the opportunities that occur to us from these so-called obstacles. And so we're just mostly behaving helplessly, watching as they unfolded and running after. We're not proactive as other parts of the world. We're, as I used to say, we are solving the problem of yesterday, tomorrow. And that's what is happening to us. And that's why we don't seem to have really benefited from this experience. We're a country or a region that learns from forgotten lessons. We operate on lessons forgotten rather than lessons learned.
All right, go ahead.
I was just going to say, we have Professor Innocent Uja, NMA president, who is driving. If you can hear us, and let's quickly ask you, and this is essentially for the Nigerian Medical Association, when COVID-19 kicked in its peak, how did the NMA suffer?
Well, as we all know, the COVID pandemic came to the whole world unprepared. And when it comes to Nigeria, Nigeria was worse prepared. However, fortunately, the president took the leadership and constituted the PTF very quickly. However, we think that the composition of the PTF was inclusive enough. But be that as it may, we as medical doctors now reorganize ourselves and ensure that we are committed to the containment of the national response of COVID-19, but not without its own challenges of inappropriate or unpreparedness of the government and stakeholders, like the provision of PPEs, like the issues that even led to the strike of National Association of Resident Doctors, where PPEs were not there, hazard allowance were not even considered, and it took the resident doctors, a decision to go on strike, and in fact they went on strike before there was a government intervention. But by and large, it was a very challenging. It has been a very challenging year, a year that is a total loss. I don't think we gained of COVID, which is not a gain, it's a disaster, not only to the health system, but the social and economic activities of any country. It has brought the whole world on their knees, Europe and America. Just like our very senior colleague said, Professor Tomori, it has shame to expect would happen. We expect that once, but we are seeing that the developed countries are worse.
All right, well, okay, Professor Uja, we do appreciate your perspectives today on the program. Professor Innocent Uja is the president of Nigeria Medical Association. Well, let's bring in Dr. Chinwe Ochu of the NCDC. I think it was some sort of mixed feeling on the part of your agency, I stand corrected, but could you just tell us, what did this do for the NCDC? Because we know that before now, well, yes, the NCDC always did its job, but a lot changed. Tell us about that.
Thank you very much. I'm happy that I have to look at the strengths, the positive aspect of this outbreak. And I'll be looking at it from the half-filled cup point of view. NCDC was established in 2011, and we had been battling to keep the nation safe from all the other infectious diseases of public health concern before the COVID-19 outbreak struck. For instance, before we recorded the first case of COVID-19 in Nigeria, we had just 5 laboratories, public health laboratories that can test for, molecular laboratories that can test for COVID-19, and only about 2 or 3 of them that were working and functional then. But currently we have 69 public health laboratories in the country across the 36 states and the FCT, and we have 31 private laboratories that have also joined the network, as well as 7 corporate laboratories. So that is a big advantage for us. What we could not achieve within 9 years, we've been able to achieve in 10 months. For treatment centers, when we had the first case, it was just Infectious Disease Hospital, Yaba Lagos, that was ready to admit. And the patient that was, the case that was detected from Ogun had to be sent to Lagos for admission. But currently we have over 100 treatment centers across all the states of the Federation. We have also strengthened our infection prevention and control system. Currently, all the tertiary health institutions in the country have established infection prevention and control committees. This is what we have been trying to establish over time, and it has not been that easy. But this year, we were able to get that done, and we're hoping that we'll scale it to the secondary health facilities and primary health care facilities as well. For risk communication, we had strong collaborations, and we've been able to develop a risk communication and community engagement strategy that is so robust. We've strengthened our collaboration, our partnership, private sector involvement in health. And this has made it so obvious that we now see people taking responsibility for health. We use that #take responsibility as the key strategy for our response to COVID-19 outbreak. This is the first pandemic we have experienced as a country, and this is the first time that as an agency we've had to respond to an epidemic in all the states of the Federation. For Lassa fever and all the other cases, you'll be talking about 3 or 4 or 5 states at a go, but now we had to respond to 36 states plus FCT. We had rapid response teams that we dispatched to all the states of the Federation to support the response. We've also seen the states taking a lot of responsibility with this pandemic. It's not been very easy to get the states to cooperate, but this year we saw a lot of political will by the state government, establishing treatment centers, setting up public health laboratories, and this is what we believe is going to support not just the COVID-19 response, but also our response to all the other public health threats that we're dealing with. Lassa fever is still with us, monkeypox, yellow fever, and so many others. So we really have cause to give thanks, and what we are looking forward to come 2021 is to be able to sustain the gains that we have made as a public health agency in 2020.
All right, Dr. Chu, we're going to come back to you, especially talking about some of the things that happened at the beginning, because some of the problems are still what we're facing now, just like testing issues and the likes. But I want to bring in Professor Issa Sadiq Abubakar, joining us from our Kano studio. And this is in the case of research. How do you think we've fared in 2020, looking at the infectious diseases while we're also battling a pandemic, COVID-19?
Thank you very much indeed. Research is one of the pillars of our National Strategic Development Health Plan. And of course, for several years, it has always been in our plan, but execution of such researches had been very difficult. Similarly, utilization of data that has emanated from researches had also been difficult for governments to use in formulating policies, or for the findings of researches to be used in decision-making or in improving case management in the case of diseases and other health problems. That is how it has been. But with the coming of COVID-19, a lot of groups have come up with a lot of research ideas in Nigeria. Some of them are in the stage of implementation. Some are still in the planning stages, and some few have reached the stage of even publication. Now, that means COVID-19 pandemic has brought some positives in the area of research, but then we still have a long way to go, because there are a lot of things that are yet to be known concerning the virus itself, the way it is transmitted. There are some answers that we need to answer. For example, people who have had the infection, are there chances that they may come up with another infection in the near future, or do they have long-lasting immunity? A lot of researches have come out from other parts of the world with people suggesting different things. So even in Nigeria, we need to identify such facts and then be able to take decisions based on them. Then the issue of treatment, which has not been found worldwide. People even here locally have made assertions that they have some preparations, some formulations that can be used to treat COVID-19. But such are subject to verification by researchers, which have to go through the normal process of the different stages of clinical trials to prove or to disprove their claims about treatment. Similarly, the issue of vaccine is another thing. Worldwide, we are witnessing the coming up with different vaccines from different countries, and we believe that even in Nigeria, we have institutes. For example, the institute that was headed by our president of the Nigerian Medical Association, Professor Uja, he headed the NIMA before he subsequently became the president of NMA. There are a lot of things that can be done in NIMA and NIPRID and other some institutes and some universities, research centers. So we need to work and identify some of the vaccines and some drugs that can be used to prevent COVID-19. So it has been a challenging year for the people, for researchers in Nigeria as well as other countries, that we need to work harder to find solutions to the various aspects of COVID-19. Being a new disease that is just being discovered and people are working across the globe, we in Nigeria also need to work harder to solve some of the problems for the world at large.
You know, Professor Sadiq, at the time, I mean, there was a time where there were certain scenario and reports that came through from Kano. Many weren't sure about what exactly it was. So at that time, a lot was hazy. So since you are of the infectious diseases, concerning how that was dealt with at the time and the capacity that your agency or institution has now, what can you tell us about what is going on now? Because those who still have mindsets, they don't seem to have some sort of closure concerning how that was handled, what can happen or what will happen with institutions in Kano if any such scenario plays itself out again.
Well, you know, it has been very difficult for people to confirm some of the sayings that we are witnessing. However, COVID-19 is one infection that spreads so easily that people need to identify the various means, known or unknown as of now, so that we can improve on the preventive measures. And a lot of researches need to be done to find that. We are doing some minor researches here and there, but then we need sophisticated equipment to do better in our researches in Nigeria.
All right, then let me bring it back to Doctor here, because, you know, even before COVID hit, in terms of handling cases with the patients that you deal with, there was still a huge gap. I stand corrected. So now that COVID happened, are you happy? Are we paying the right attention? Because so many people suffered so many things, mentally, psychologically. In terms of the capacity of those institutions in the country, are we paying attention to it? Have we improved capacity? Are you happy with what you've seen? What would you like to see?
Oh, well, I want to say that definitely we need to increase the capacity more, you know, because right now, you know that there's a lot of migration going on in the medical world, the doctors, the nurses, they are all migrating out. So there's a huge need because of post-COVID session. There's, like I said earlier on, it has even been documented now in research that some people after having COVID-19 infection, they now come down with psychiatric illness, frank psychosis. So there's a lot of work to be done. So we need to increase our capacity and, the access to people so that they can come. But, everybody have to put barrier, the PPE, so that, you don't want to take it home too. But there's a huge need out there. And we need to increase our capacity. There's no doubt about that.
Professor Tomori, I'd like to bring you in, and this is looking at several other diseases that, we also experienced in Nigeria, apart from the mysterious deaths. Take, for example, the Lassa fever, yellow fever, and there was, of course, the good news of the wild polio, where we were declared free sometime in August. Looking at how, 2020 has gone by, how would you describe how our efforts towards those other diseases and the success of being free of wild polio?
Thank you very much. I quite like my colleagues for their optimistic outlook to what is happening in the country. But in the reality of it, let's be frank with ourselves. We have not done well. Let's be frank with ourselves. I remember when Chikwe came up, at the beginning of the year, I was talking about building labs, and I said, yes, Chikwe, I don't envy you. I admire the efforts you are putting, but you should not be building labs now. We're 60 years of independence as a country. We had labs in this country that were functioning before. What happened to us? Those are the most important lessons here that we need to learn. This is not the time for us to be building labs. This is the time to be using labs that have been built and sustained. And so, I think we need to be very, very careful. I like optimism, but I also like being realistic. So let's talk about Lassa. Lassa fever has been with us, 50 years, if I remember. And if you look in the last 3 or 4 years, every year we have had more Lassa fever cases reported than the year before. I think in 2019, we thought that was going to be the largest number. But the following 2020, the number went up. Following 2021, the number went up. And again, people always want to play things in the type of positivity. I was told, it's because people are now becoming more aware, and that's why we're reporting more cases. But NCDC was set up not to report cases. NCDC was set up to prevent cases. I think those are the issues I think we begin to look at what we're doing as a country. More cases, now yellow fever is all over the place. It's coming into so many other places. When people were saying this is the first time we're dealing with pandemics, that's not true. We had pandemics of yellow fever back in the 70s, in the 60s. I remember between 80 and 91, we had yellow fever all over this country. The laboratories that did that, this was done in Ibadan here. We didn't have to go to Dakar to confirm our things. Why are we moving backwards? These are things I think we should take the opportunity of this to look back on those areas. I like our colleagues, let's paint the positive side, but at the same time, let's be realistic. That in 60 years, we are where we are because we have abandoned the things we should do. We have not sustained what we have. And I think we need to, we like funding to our government. The other day, I was at a meeting when one of the ministers got up and said, COVID is killing everybody in Europe. It's not killing people in Nigeria. It knows what the government is doing. And I got up and said, yes, COVID is killing in Europe, but your deduction that it is what we did right is wrong. It is what the virus has not done. That's why we are not having the problem we're having. We have not done the right things. COVID is new to everybody in Europe and everywhere. They are learning as we are learning. The success they have made there, we can't compare it to the success we have made here. Because the environment for our colleagues, I think it is important for you, our colleagues, let's tell the truth to the government. Let's speak truth to power. Unfortunately, power in Nigeria is death. So I think it's time for us to empower truth and move a step further. And all these fancy things we are saying, we're doing, government is doing that. We should stop it. Let's talk the truth and tell the government what it is. Take the issue of risk communication of information to people and getting awareness to people. Are we aware in this country? You see, people are still, in fact, in my state today, they're going to do a crossover service. And the governor just quickly canceled the, whatever you call it, the curfew that is set up. And then because he wants to pander to the religious group. And now people are going to go out and have this. These are the issues we're talking about. Our governments are talking incoherently. Ogisti says they don't have any COVID. Cross River has the same type of thing. Some of the states, no, they're not testing. We know that. But we're not telling these things to the people. They get them $1 billion to test, to treat, to this. How many of them are testing? My friends, let us talk and tell the government the truth, because they depend on us to tell the truth. And if we are pandering to them, they will never know what is right.
All right, Prof. Well, you heard him. We'll explore that a little further when we return in just a moment. Stay with us.
So the special program here on Channels Television 2020, the year of the pandemic. We're speaking to our various guests, of course, at Ibadan, Professor Oyewale Tomori, Dr. Chinwe Ochu in our Abuja studio, Professor Issa Sadiq Abubakar, and of course here in Lagos, Dr. Fumilayo Akinola. I'd like to continue with Dr. Chinwe Ochu, and that is responding to some of the things that Professor Tomori talked about just before we went on the break. And I mean, a few of what he has said is that it appears we're not telling the government the truth. And I know that I've taken a look, I've received a lot of the incidents reports from the NCDC, and one of the recurring problem has been that the trust in government, the people's trust in government has been affecting the messaging of the non-pharmaceutical protocols and others from the NCDC. So respond to some of the things that you heard Professor Tomori talk about, and perhaps this in line with our review of the year 2020.
Thank you again, Millicent. I sincerely appreciate our senior colleague, Professor Tomori, for all those challenges that he has brought out. These are challenges that we're dealing with as a nation and that had been with us even before the COVID-19 outbreak. As much as we would like to look at those challenges, which we'll be bringing out also in these discussions, it's also very, very important that we acknowledge the great efforts that went into responding to this outbreak and the various achievements that we have made as a nation. Let's face the facts. We have a digitized surveillance system that was scaled to several states in the country during this outbreak. That is an achievement that we should applaud. And Nigeria as a country actually was very proactive in some of the measures we took during this outbreak. Right from January, when after China announced the strange virus, we started preparing. That was when we did a risk assessment. With that risk, from the result of the risk assessment, we set up a national coronavirus preparedness group that was multi-sectoral and started preparing for this outbreak. A lot of gains. And we instituted most of the public health and social measures even before other countries like the civilized world. Yes, we may not be where we want to be now, but we should always look at the baseline. Our baseline may not be the same as the baseline of those other countries, but how far have we moved from the baseline? That is what we are looking at. For sure, like you said, Millicent, there are challenges. For risk communication, we know that government distrust is a big issue, and that did not start with NCDC. That has been a problem that has lived with us over the years due to all the events that have happened with the government. So people find it difficult to trust the government even when the government is saying the truth. And that was what helped us in developing a strategy around that. Another challenge we had was also the COVID paradox, which Professor Tomori also referred to when he was talking, where you see Africa not having the same kind of impact as other countries of the world. We're not having the same kind of, we're having fewer cases and fewer deaths. So people feel they are not threatened. Community risk perception is very low. So with all those, telling people now to adhere to these public health measures becomes a big challenge. These are some of the issues we are dealing with. And once these challenges are identified, the important question to ask is, what efforts have we made to address these challenges? For the community, low-risk perception in our communities, we have strengthened our partnership even at the community level. We have we have worked very closely with our traditional leaders, religious leaders, making use of opinion leaders and those that we call trusted voices that people trust. We've seen ourselves moving from that top-down approach to risk communication to a bottom-up approach where the community themselves are engaged to develop their own risk communication messages and pass it across. Yes, we have challenges, but we are moving forward. We are progressing, and we are hoping that all these gains, because if we're able to identify the gains from 2020, we will now work towards sustaining these gains. And let me also correct, just a little correction, that yellow fever outbreak of, the one that happened in all the states of the country did not happen when we had NCDC. This is the first time NCDC is having to deal with a pandemic that affected every state of the country. And this is just an agency of about 300 staff. And we had to deploy rapid response teams to all the states of the Federation. So I think at a time like this, the last day of the year, is a good time to commend the efforts of the dedicated staff and workers who have given themselves to ensure that this nation is kept safe.
Let's go to Dr. Sadiq Abubakar in Kano, and this is perhaps maybe your concluding thoughts on all that we've been discussing, and perhaps would also like you to weigh in on the non-pharmaceutical measures, because we know that we're still going to be living with the virus. It's the new normal into next year, 2021. What do you expect that the government and the agencies, the Ministry of Health, also that of the state, the subnationals, should be doing moving forward?
Okay, you see, fighting this pandemic is kind of easy, but then that will be possible only if all stakeholders get up to really do what everybody is supposed to do. By this, I mean the government, the health workers, traditional institutions, religious leaders, as well as individuals. Everybody must see to it that the non-pharmaceutical preventive measures are the key, especially in our environment, because we have difficulty in accessing the vaccines, being the other tool we have at our disposal to fight the pandemic. So we have to work very hard to ensure that everybody comes forward to help in fighting the pandemic. So the non-pharmaceutical measures are very easy to practice, but if everybody complies with the directive, we need to intensify on our hand washing practices, the use of hand sanitizers. We need to de-emphasize large gatherings. We need to improve on our cough and sneeze etiquettes. We need to ensure that people who are ill get assistance from the health sector in good time. And that is when we will be able to reduce the number of people who are infected that can easily transmit these diseases to other people. It is when all of us play a part that we will be able to reduce the rate at which the number of cases are increasing. The government must assist people who are willing to partake in preventive practices. Government must be able to help people to ensure that there is adequate water supply so that the hand washing practices will be possible. Government needs to help industries that are willing to manufacture the hand sanitizers, our face masks, so that people will get it at an affordable price and be able to use it. And then we have institutions, our places of work, our schools that are about to resume, especially with the resumption of ASU, back to work, back to classes. One very big problem, one very big challenge that the universities will face is the inability of the universities to provide facilities for physical and social distancing. This is going to be a huge challenge, and I'm sure that the vice chancellors of various universities are now trying to find solutions which are not going to be easy to come by. But then we must find a way, because we have to continue with our education, with or without, in the presence of COVID or not.
All right.
So, as I said earlier, I still maintain that it's going to be easy, but if everybody plays a part.
All right,
our
Prof,
traditional institution must help.
Okay, Prof, we hear you quite all right, but we need to bring it back here as well. Dr. Akiola, there's this debate out there as to, because clearly we're not out of the woods, the vaccines. Some think, well, we may not. Even the NCDC themselves think, look, it's going to be a challenge convincing people to take it. What do you think?
Well, I want to agree with you. It's going to be a challenge, because the first thing is people don't even believe the COVID-19 infection is real. So how are you going to convince them to take a vaccine for something they don't believe in? Then there's a lot of information going on the social media about, is it real? Is it correct? The side effects of the vaccines. So people are just not there. They don't want to take it. And it has a lot of religious connotations too. So there's a lot of misinformation, information out there. So really, if the government wants people to take this vaccine, they really have to make a stand and tell, the public the truth. And many people don't keep to the rules. Because number one, they don't believe that it is real. And they do not understand all this physical distancing, putting on your face mask. So you should not stay in a room. They said it's 50% capacity, but that's not the point. The point is you should not be in a room that is enclosed, because if anybody has it in there, that means the virus is in the atmosphere, so anybody can catch it. So it's not just that you should have 50% capacity. It shouldn't be enclosed. The windows should be opened. So now physical distancing, put on your face mask. You want to cough, like you said, you cover. All this, we need to keep saying it. And they say how many people actually watch TV? But many people listen to the radio, that I know. So we need to do more about this knowledge. So we tell people, go, where are they in the marketplace? People don't believe. You go to the market, they will tell you, there's nothing like COVID. All of us in this market, nobody has had COVID-19 infection. True. So how are you going to convince them that they need to do physical distancing and put on a face mask? So the government really has a lot of work to do about education. We need to go down there and let people know.
So perhaps a difficult task, and this is going to you, Professor Tomori. Is this a huge task for the people, for the government, those who are in charge of a lot of this? Your conclusive thoughts on this.
Yeah, talking about vaccines is going to be a terrifically difficult task. And the reason being that up till now, our government has not come out to counteract all of this. What you find on social media is the wrong information about vaccines. By now, our government should have put out something on question and answer, which they give out on a regular basis. I was just telling, and your station, everybody, I was just saying to the NT, I said, instead of telling me that Buhari went to Daura, the first news should be question and answer about vaccines. Let the people know what the vaccines are, what are the real stories they are telling, and all those kind of things. So they get the information, which allows them to do this. Because if they don't give that information, all they are hearing is what on the social media. We are not proactive enough. We are thinking we'll get the vaccine in January. We are still not started talking to our people about what the vaccines, what are all these stories about vaccines. So I want to clear one thing. Our younger colleagues learn from history. It is okay for NCDC to be sending response team to all the states. In those days, states were the ones that were dealing with their own problem. And they only called on federal when there was need to. Why did we do it? These are the things I think on history will tell us. And what NCDC and others are doing now, you are covering up the errors of the past. When we should have gone there. States were doing their things in those days. And the federal only got to know when they couldn't handle it. That's the direction we should be going. And that's the point I'm trying to make. Well done, the NCDC, and for all the great things you have done. But you are catching up on the failures of the past, which is not your fault, but the fault of the country. And these are measures, I think, that I said, let us talk truth to our government, so that we know where they made a mistake, where we ourselves who are addressing them are making mistakes, so that we can get this country to where it should be. I'm talking with confidence because I grew up in this country and I knew what we were doing in our time. I didn't leave this country for any study anywhere, but we trained our people here, we did our things here. States were doing what they were doing, but they only came in at the last moment. Right now, today, you heard what Shoyinka was saying. Over-centralization of everything. It affects everything we're doing. We need to get back to that place, equip, empower the states to do their own problem. And then federal can do much better at supervising that they're doing instead of NCDC running helter-skelter all over the country.
Well, we do thank you for your thoughts, Professor Oyewale Tomori, Professor of Virology, joining us via Zoom from Ibadan. Well, we also did host Professor Innocent Uja, who is the president of the NMA. He also joined us via Zoom from Abuja. And then Dr. Chinwe Ochu, leading prevention program and knowledge management of the NCDC. She joined us via Abuja studio. We equally had Professor Issa Sadiq Abubakar, Director, Center for Infectious Diseases Research for Bayero University, join us from our studios in Kano. And then here, Dr. Olufemilayo Akinola, Chief Consultant Psychiatrist, heading the Oshodi Annex of the Federal Neuropsychiatric Hospital. Thank you very much indeed for your time today.
Thank you for having me.
All right, and so we will be back in just a moment. It's 2020, a year of the pandemic.
2020, a year characterized with a lot of things, severe security challenges across the country, and that's where we're going to, discussing security. And joining us are several guests. Let's begin with our guests here in Lagos. We have Juliet Benite, representing the Institute for National Transformation. Thank you for joining us.
Thank you, ma'am.
We also have Emmanuel Dina, a public affairs analyst. Thank you for joining us.
Thank you. Welcome.
From Abuja studio, Major General John Enenche. Thank you for joining us.
Thank you for having me in your studio.
And Professor Khalifa Dekwa, a public affairs analyst. He joins us from our Borno studios. Thank you for joining us.
Okay, so let's start off here in Lagos. Wow. What can we do without security? Well, let me start with you, Mrs. Benite. Yes, it came with its own challenges as well. The year 2020, as much as we had COVID, but security is even a huge challenge, and it still is, because governments, everyone's still trying to look over their shoulders and trying to see, did we get things right? Where did we miss it? How do we correct it? How did it come across to you?
Well, 2020 just revealed in deeper ways that we had serious security problems. 2020 did not create the security problems we have in Nigeria. It just revealed it more. And with students out of school, poverty on the rise, people not sure whether their government is concerned about them, the heightening of everything. Things were not even managed before COVID-19. We had the issue of Boko Haram. We had the issue of Fulani Hezme terrorists. We had many other issues of kidnapping in the east and the west. Everywhere across the nation, there were security issues. So by the time COVID-19 presented itself, the pandemic just simply unveiled deeper that Nigeria's security apparatus and everything concerning security had an issue. So whether by the time the youths were reacting to NCDC, it was as a result of the height of what they've been through. Because my son was a victim also. So I know when I saw them reacting towards it.
The victim of what? The SARS or
yes,
the NCDC protest?
The SARS.
The SARS itself. Oh, okay.
At one point in time, he was just strolling, going on. I mean, he likes walking. So he said he would rather walk than take a cab. Then they grabbed him. And he said he just felt in his heart that he should run. And I was even telling him, I said, why do you think you should run if they had shot you? He said, Mom, they didn't have a uniform, their car was unmarked, and he just felt that maybe they were kidnappers. So he took off, they tore his shirt, so he came home with a torn shirt. So I met the police stand in that area. I said, what's happening here? I heard that there's an unmarked vehicle picking up boys. Somebody just told me, confirmed that it's not today it's been happening. He said, oh, madam, na SARS. I said, na SARS. You know, I was shocked, and that was 2 years ago. So we have been having these issues, and I think that the pandemic 2020, for many nations, just simply exposed the gravity of what was happening within its sectors. And institutionally, we saw that our security institutions, with the biggest, had many issues. So this is not just the military issue, the police issue, or private security, the rise of Omotekon, and all the issues and the noise is as a result that Nigeria has not paid the price to establish her security apparatus commensurate to her democracy. Because what we have a lot of security issues that has to do with how we look at security and what their roles are. So there need to be a total overhaul. So 2020 just unveiled it, and I hope that even as we go into 2021, we begin to look in detail as the institutional issues, not just the activities of what this whole apparatus is all about. Mm-hmm.
Still talking about security, I'd like to bring in Major General John Enenche, and this is first to get your overview of, perhaps from your position as a spokesperson, the Nigerian military, what you think security, how you would describe security in 2020.
Thank you for that question. What I can say from our perspective, the armed forces, the security situation for year 2020 was one that was unpredicted. It did not follow the projections that we made at the beginning of the year. The simple reason being that some other societal challenges came in, which tended or seemed to hike up the rate of insecurity, and these are just two major ones: the NCDC, which came after the COVID pandemic. We realized that the projections we had, packaged alongside the expectations of progressive development, progressive improvement in the area of equipping, training, and other things to tackle the challenges we had at hand at the beginning of the year. The dynamics, everything just changed just from March this year. So we can state it clearly that it was a complex situation for us that we had to manage with a lot of ingenuity and a lot of thinking out of the box for us. So it was not a straightforward thing at all. For us, it was a complex situation that we needed to think out of the box to be able to be where we are as at today. So 2020 for us was a year of mixed feelings, of not having to follow the path of your earlier projections and plans that you will make at the beginning of the year to take you to the end of the year, because it was truncated with, like I said earlier on, with the fallout from COVID-19 and then the NCDC issue, which made it to appear as if, of course, it is the truth that there was a change even in the criminality. Criminality tended to increase, so that is the way we see it. And having that in view, we have taken our lessons. There's what we call lessons learned from after action review. After action review has given us and exposed some of the things that we needed to do so that we can now be better positioned to work and then tackle all the challenges ahead of us for 2021.
Well, Major General Enenche, if I could follow up on some of those issues you've raised, when people hear that some of those things were not part of the projections or the intelligence community missed out on some information, they wonder, because there were several notices. In fact, there was even one from a risk assessment firm, Verisk Maplecroft. They did this analysis and then they published it in July, way before even the NCDC one came through, that as a result of some of these, COVID, for instance, Nigeria was among the 37 countries that they said was going to be a high-risk area where there'll be a perfect storm, there'll be protests as a result of these things. So how come the intelligence agencies missed some of these reports that are usually out there?
If you are talking about intelligence agencies, let me, intelligence agencies is not strictly the military. When you talk about intelligence agencies, I want to believe that you are talking about, first and foremost, the state service, among others, state services leading it with the police and others, not strictly military. But again, looking at, when I talk about military projections, they are different. Completely, people don't even sometimes understand the way it is on the ground. When we have our strategic plans packaged with our projections, we take just a little look at, as per what you just talked about, mentioned all these other people, all these other groups, organizations that come up with their own various is it plans or projections or estimates or whatever. We call it estimates. So we do our own estimate based on various indices. And that is what we do. And that was what we did. And like you said, the way the COVID-19 came, the lockdown, nobody thought of lockdown as at the time when COVID-19 was exposed in December 2019, that a virus has come like this, from China and all. Nobody thought that a measure was going to be like lockdown. And the lockdown actually, brought some issues out. And then some things happened as a fallout from the lockdown. The same thing with the NCDC. If they talked about NCDC, nobody knew NCDC was going to be hijacked. Eventually it was hijacked, and you can imagine what happened. So it is not a question of a failure. For me, permit me to speak now for the armed forces and security agencies. It's not strictly a failure of intelligence. Sometimes you have the intelligence, and there are other things that face you in the face. When you talk about what if you act on the intelligence, what about the damages that could follow? What about the other fallouts? So for us, rather, it is not failure of intelligence that caused others, but there are issues. I'm happy one of the speakers earlier said that, look, there were problems on the ground. We are just seeing a manifestation of remote issues that are just coming up. We talk about SARS. SARS has been there for for a decade, 2 decades, thereabout, but now something is coming out of it. We talk about the COVID. COVID, there were variants of that kind of viruses that affect the respiratory tract, only for this variant to come out with so many propositions that it must have resulted from that. So for us, I don't think it is an issue of intelligence failure. Some people may look at it that way, but no.
Well,
it is not true.
Are you telling us directly that not even the DMI knew that these things, which you say they missed, was going to happen?
Well, I don't want us to turn this into gist. If we turn it to gist and entertainment, sometimes if I say that the DMI doesn't know, he knows, I am going beyond what should be divulged to the public. And I think in the interest of me and you and the general public security, and to protect the way we manage our information, we should not, bring out, I have limits, and the limit is the interest of the general public. So I will not answer that question yes or no for our interests.
I'm only following up what you've said, that you didn't see that coming. Nobody knew it was going to be hijacked. Those were your words. So it's just a follow-up of what you already said. But not to worry, let me bring it back here. Mr. Dania is here as well. Can you relate to some of what he said?
I probably would start with, and I think that the question that you asked the gentleman was a very appropriate question. I don't think it was out of line. And I think when we have meetings and talks like this, we should all be very sincere with, the things that we say. And I think that is, what the problem is in this country, that at every level, there's no sincerity. What particularly bothers me is the security agencies in Nigeria. I grew up, with great admiration for the Nigerian army, for the Nigerian police, and for the security agencies. And I'm sure that many of them today will agree with me that where these institutions are today is far from where it should be. And I hope that there will be individuals amongst them who would understand the gravity of this and would ensure that they restore, the dignity of these institutions. When the gentleman said that they did not see the projection, it's anywhere in the world, every country in the world had the same situations we had. They had the COVID pandemic. They had, in the US, they had civil unrest that was worse than the NCDC. Mm-hmm. But the security institutions there, because they were all working together cohesively, were able to work and maintain, to an extent, law and order. In other words, there were things that were predicted and they saw. Perhaps maybe we are giving too much responsibility to the table, the doorstep of the Nigerian army, because, like you rightly said, it's not in their, it's not just the army. They're all other agencies, and what this shows that we've always known is that there's no synergy in all of them, because if they had synergy, everyone should be fully informed about the security architecture of the country. So, like she rightly said, it's just exposed a huge, humongous gap. Nowhere in any nation should we have, a security agency say to the people, that our projections weren't right. It's unacceptable. I'm sorry. It's totally, completely unacceptable. Then what are you there for? What are we paying you for? What's the purpose of your existence? If you can't carry out the responsibility given to you to protect the citizens, you are put there to think, to project, to expect, the unexpected. And so if you're not doing that, for the life of me, I don't know what it is that you're doing. And so I want to repeat that I believe that there are individuals, wherever they are, to continue to fully take responsibility and bring these institutions back to the glory that they've always been. And I would like to see that in my lifetime, where a military man is speaking, and is speaking with authority, is speaking with dignity, is speaking with truth, and is speaking with fairness, and all the security agencies, the police. I believe it's something that I would like to see in this lifetime.
Major General John Enenche, would you like to respond to what he just said?
Well, I will not directly respond to it because they are just personal, and there are just his views about it. They are personal to him. And that if I respond now, that means I will have to begin to respond out of my ethics as a military man, and then the rules that guide my job here. So how will somebody begin to say that something that was not, talking about projections? I think he's misunderstanding me out of context. And like I said, I hardly go out to go for entertainment, to go for argument, and I think I've told that to several of the media houses. Let us talk what we educate and then help the public. But it's just turning to something like you are coming to argue, to come and discuss, and then I am not a good orator, so that I must confess. And I will not respond directly to it because, let me say, it is his own opinion. People are listening, and of course they should make their judgment out of it, because I believe he's a highly intelligent person and then somebody well exposed. I also, because you asked me a question, whether the DMI is aware. Why should I come to the air and tell you the DMI is aware or not? Or it's just the same thing about asking me to tell you what happens in the intelligence fusion. There is nowhere in the world, as far as I am concerned, and by my training of over 35 years or thereabout, where you come out and start divulging all the information that will help you, guide you in your operations, or what to use to achieve for us modestly to where we are now. It is not done. So, and like he said, one needs to be truthful. There are things that you call unforeseen. When you plan for all of the unforeseens, you do your estimate and then you do the projections. And then the projections like we did and we normally do, yes, of course, nobody knew that NCDC was going to become what? Going to turn violent, was going to be hijacked. Nobody knew that at a particular point in time that there would be lockdown, or there were going to be a lockdown. The lockdown brought a lot of things. Those were the things I was talking about. Not that we did not have projection plans for exchange of cases. And if not for the plans that we have, I believe that it would have gotten out of hand in a way that is unimaginable.
Just give us a moment. So we need to go to break. But we'll come back and continue this conversation in just a moment. Join us again.
Welcome back, and we're discussing Security 2020 in Review. We've since been joined by Mr. Oluwatosin Benga, and he's an NCDC protester. We'd like to thank you for joining us. He joins us via Zoom. Just quickly ask you, and this is perhaps, I mean, no one saw NCDC when it started, and to the point, you know, the aftermath as well, and what we've seen, and this is the judicial panels across the country. But tell us briefly about your experience, that moment, perhaps up to this point, if indeed you felt the protest, going out to protest at that time, that, you know, there was some sort of success.
Yeah, absolutely. We didn't actually get the right success and what we wanted to achieve eventually. But the fact of the matter is that NCDC protest actually radiates across the world. So we got global attention to so many e-governance happening in Nigeria, all right? So everybody's aware about so many things that is actually happening here. Personally, I've been a direct, I've had direct experience with police officers who have extorted, you know, my brother to the tune of about 250,000 naira right here in Lagos. So the protest is a bit kind of very, very personal to me, around the fact that this is actually the time that we're supposed to stand up and actually fight against police brutality. If you have followed through the trend as it has happened from previous years, you know that the agitation against EndSARS has started since 2017. It has started in 2017, and people from the digital platforms like Twitter have been agitating against it. And government have been promising that, oh, we will end EndSARS. They will release statement that it has been ended. They will tell you it has been disbanded. So they've reduced about 3 to 4 different nomenclatures to tell us that EndSARS have ended. But unfortunately, we still observe that people still experience this kind of brutality from the police, especially the young people who are actually, like, for instance, I'm a software developer. I move around with my laptop. I use sophisticated equipment for my work. So any police officer that sees you assumed, you know, that you are a fraudster. And most of them actually know that you are doing things that are legitimate, but because they want to extort you, so they are actually interested in extorting you and putting a crime that you do not commit on you. So the EndSARS protest is actually like, you know, it is actually like an explosion of what has been boiling over and over again. And the fact that we have many students that are at home during the, you know, there is ASU strike. So there is enough of reinforcement for people to actually join that particular movement. So for us, like for me, the government is actually trying to buy time with this judicial panel that has been set up, because for me and for some of us, this is not actually what we wanted. We want a nation where young people will have the opportunity, you understand, and the freedom to express themselves, to move out, freedom of movement. Till last week, we still got calls of police taking people on the streets arbitrarily and asking you to come and pay 10,000, pay 20,000 to bail your family members out. You see that the real issue has not actually, you know, been addressed. It is the institutional corruption and ethic decadence within the police force itself that needed to be addressed. You know, the panel is to address things that have happened in the past, but the institutional corruption happening within the police force itself need to be resolved. And like I've said at various times, the solution to police brutality is very, very easy. One, if there is any police station where, for instance, anything happened, the DPO of that particular police station is supposed to pay for what those that are under him have done. So if it happens 3 times within a command, the head of the command, the police head of the command is supposed to pay for that. If we are done with that, if it happens 3 times in a state, the commissioner of police of that state is supposed to pay for the inaction and action of those people that are under him. So it is until when there is consequences for actions, that is when we will be able to say that the EndSARS protest has been able to achieve what it is actually meant for. But we are still watching, you know, because most of us are not actually happy about how the whole thing actually turned. Some agent of government sponsor talks to come and attack protesters. In fact, they killed some of them. in Lagos at Alasa there, a guy, his image is everywhere on the internet, came with cutlass. The government have not arrested that guy and prosecuting for disrupting a peaceful protest. You see now. So the people that killed and burnt cars of protesters in Abuja, nothing has been done. Nothing has been done against them. So these are the things that we're talking about. You cannot say you are setting up a panel and some critical things that you're supposed to do, you did not do them. It is the right of citizens to protest. So if talks come to attack protesters, what is the government supposed to do in such an instance?
Okay, well, we understand what you mean by pay to be in the line of taking responsibility for men under him, but we'll come back to this in a moment. But Major General Nenche, we had to butt in to go to break, but, you know, we're not asking you to necessarily divulge official information, and you don't really have to be an orator for people to understand your perspective. You were making the point earlier, but we also believe that, look, it's about perception. People are watching you, listening to you, because, I mean, you heard them say here that they grew up with admiration for the Nigerian army, so it won't be out of place to let people believe in the work that you are doing. But could you go ahead and conclude the thought, that the point you were making before we went to break?
Well, I will not go further than what I have said. As at the time you cut me short, I think I've said what I wanted to say. So that is it.
Okay, then, but we'll come back to that as we progress.
Let's go to Professor Khalifa Dikwa, who's a public affairs analyst, joining us from our Borno studio. Thank you for your patience. We're discussing security 2020. When you look at the situation in the Northeast and the Northwest, compare it to 2019, would you say that 2020 was better off? How would you analyze it?
Thank you. This is a great question. 2019, 2020 had been terrible for those of us in the Northeast, in that we were faced with a cat and mouse or Tom and Jerry instance of insurgents and the military. And therefore, that was not the military that we knew, that was applauded by the international community. That was then the Nigerian military that was always invited to quell crisis in other countries, Liberia, Sierra Leone, even Congo, Ab initio, all these things are there. And insurgency for us, just up to 11 years now, it was not accidental. Because at that time, prior to its commencement, I had cause to warn about it because I stumbled on the classified documents in Europe as a student. But nobody listened, and in fact, there were people within government who were actually acting the scripts of foreign interests. And therefore, it was not accidental, and rather than saying the year of pandemic, it is the year of manslaughter, humiliation, killing of famine, anything negative. But that was actually the ideology of the insurgency itself. If you wanted to kill a country, you kill the education, you kill the healthcare system. By education, I meant under normal circumstances. For instance, ASU will have been left to remain on strike for 9 months. 9 months being a complete academic year. And therefore, to us, discipline, lack of discipline within the ranks, lack of cooperation among the security and defense agencies, it is about just grandstanding and lack of query, particularly from the leadership. We expected the president or his vice president, President Buhari and Vice President Osibanjo to have had the initiative of surprise visits to the rank, to listen to those at the front lines, talk to them, to the high, to the mighty, from time to time, listen to them one-on-one, and ask about their own concerns. And again, I dare say that perhaps there was something wrong with the ordering system, the command system of the army, in that the police is even better, where you see a field commander could not even take the war to the insurgents to smoke them out, rather waiting for orders to come from above. And therefore, the police, for instance, if faced with danger, the police will defend himself, but at least neutralize the enemy before waiting for orders and so on. And to us, Northeast was not, like I earlier said, it was not accidental, it was planned, and it was waiting for the leadership under a democracy to implement it. That is how, look at Nigeria, is the only country without foreign troops. Even if there may be just a technical so and so on. And it was just about neutralizing or pulling down Nigeria, not to allow it to stand as a leader of the continent, lead the continent into peace, lead the continent into having to deal with internal, intra-continental trading, lead the country to at least have 5 regional currencies, and so on. And imagine, you see, Nigeria, for instance, is not different from Congo. You remember the first speech of the first and only Prime Minister of Nigeria, Tafawa Balewa, who spoke about Congo, restoring peace to Congo. And that country, Congo, is still at war, despite it having diamonds, gold, gas, oil. And it is the same thing with Nigeria. It is about economic war economy that was being planned from outside, and that it had to have certain people who are likely to compromise the security and defense of the country. Had we had the president or his deputy coming after any attack, anybody, when our troops were led into ambush, some heads should have rolled, because Nigeria couldn't afford to train great soldiers and so on, only to lose them to these rascals, to these idiots, to these killers who do not even know what they were doing, because they were killing and destroying their own country on behalf of foreign interests that never wanted Nigeria to be on its own. And therefore, that level of patriotism has not been there. And for some people, those who are in the public relations and so on, to be coming from time to time to tell us that the military attack destroyed social insurgents, took some rifles and so on. Things that could have been finished within 11 days, 11 weeks. Today we are 11 years and we are still counting. And therefore, what happened in Zabarmari was just one of such instances where the media did not report. Outside Maiduguri, anything can happen, and this is a fact. And that it was Northeast because of its strategic position linking Nigeria to many African countries, notably Niger, Chad, Cameroon, and up to Sudan and Central African Republic. Just count all these countries with resources as diamond and so on. Poverty is there, war is there, anything that you can think. Nigeria is the only country without foreign troops around, and that annoys them because they are not happy that Nigeria did not open its kitchen for them to come and do one good thing and destroy 99 others. And therefore, to me, it was something like a plan, there's something, a script that is being played when leaders could not check, could not give time frame for an instruction. Do this project. If there is something wrong, come and inform me. Within 3 months, 6 months, every minister, every chief of defense or security, as the case may be, should be able to submit a report. And that report could be cross-checked by somebody outside. The vice president, the president himself could pick a telephone and call anybody from the northeast to tell him the truth about it, rather than keeping quiet and waiting for reports to be submitted
Professor Dikwa,
to the
could you
presidency without
share
checks
some
and balances.
If you can hear me, I'm trying to understand. Are you suggesting that some foreign military personnel want to come into the country, or you're asking that they come into the country? Could you clarify that point exactly?
No, we are okay with foreign, but not outside the continent. If there's something like United Nations shouldering the peacekeeping operation, let the troops be from within the continent, not outside the continent. And this insurgency of a thing, when I started talking about it, we said this is not a conventional warfare. And therefore, our military should invite instructors from similarly embattled states or countries like Afghanistan, Iraq, Somalia, and so on, to teach this particular guerrilla warfare to our own, so as to finish with this thing once and for all. And this did not happen. Today, 11 years, and a lot of money has been sunk. The president had given them everything they needed.
All right.
But
Professor Dikwa, we have Major General John Enenche on, and so I know he'll have a lot to say in response to a lot of the things that you said. Major General John Enenche, while you're thinking about your response to what Professor Dikwa has said, I also want to ask, because we get the news from you a lot of the times about the airstrikes in Sambisa, one location or the other, the bombardments, the reconnaissance, the surveillance. But we also wonder, while we see all of those pictures, satellite pictures, if indeed maybe troops go on the ground to follow up or mop up on some of those activities.
Well, like he rightly said, asymmetric warfare is completely different from conventional warfare. However, I think I can say this, that all our operations, whether in the northeast, northwest, across the country, they are all joint operations. And when you talk about joint operations, you have the various components, the land, maritime, and air component playing their role. And the thing we do is, of course, like you said, when the bombardments are going on, we have blocking positions, of course, that is manned by the ground troops. This time around, the people normally call them the army, but of course, you could have a mix of army, navy, and then the air force with the special forces. So it is not that once the bombardment is going on, particularly in areas where you have route outs, where they could file out of their enclaves. We manned those areas and to block them, and then we take them out also equally. So that is the way it is conducted. They are all joint operations conducted by the Army, Navy, and Air Force.
You heard about the pain and the fight against insurgency for over 11 years, especially in the Northeast, from Professor Dikwa. How would you respond to that, seeing as, I mean, it's your line of duty?
No, it's a fact now. There's nobody can contest that we have been fighting this insurgency, trying to contain them for the past 11 years, and it has metamorphosed from one form to the other. But what I can say is that it is rather unfortunate that all over the world, insurgency, terrorism, they are very resilient. And it's a similar thing that we are having. But for us, the encouragement is that from having controlled territories, now they don't have controlled territories on the ground where they have authorities, setting up administration. And then from where bombing, terrorism was all over the whole place, they have all been contained to, skirmishes, isolations here and there. In that way, we looked at history, and he talked about training. I would say that we are up in training, collaborating with other foreign concerns that have been in situations like ours. And like I said, it's not all like we come out to tell people that is what we are doing. So we are doing that. And he's very, very right that we have been 11 years into this now. But for us, we are making effort to ensure that it is eliminated as soon as possible. But the encouragement we have, like I said, is that the way it was some years ago when it started is not the same way now. Otherwise, somehow, because we are all concerned that what you are doing, you are not getting the expectations, particularly of the general public. Yes, it's a concern. So it is a truism that this situation is on the ground. And like I said, we have, our planning teams which review everything that we do, and the plan of today is not good enough for tomorrow in insurgency and terrorism. And that is what we are doing as we get into 2021 with hope.
Well, let me bring it back here, Mrs. Benite. Was that a disagreement we were hearing from you while he was speaking?
You know, the problem I have with an insurgency of 11 years is an insult to the largest black nation in the entire world. Nigeria is not just the largest black nation in the world. Nigeria is one of the highly educated nations, black nations in the world. And wherever Nigeria has gone to, we have dominated. In the United States, we are dominating in medicine, we are dominating even in the military. The crisis we are having, and because we are speaking to Nigerians, we must encourage them and give a roadmap to an end of this madness. And I call it madness because as much as they are not taking territory, it has become more clandestine. We have people in northern Nigeria, in Plateau states, and in many of the states where villages have been taken over. I know because I have been informed. Their villages have been taken over. Villages have been literally ransacked, and people cannot go back. We have the IDPs going on forever without an agenda of rehabilitating these people. When we talk about the security of a nation, it's not just in the aspect of military security, police. We're talking about food security, financial security. Because when you have perpetual poverty and you are the capital of poverty in the world, which you have no business being, you are a breeding ground for a consistency of such madness, of having whomsoever, like Professor says, who are those people coming into our nation and wanting this to perpetuate itself? They must have partners that have made it so. I'm part of military institutions, and when we say military and paramilitary, because sometimes we put all the burden on the military, which I don't agree. We have the police internal issues, we have SSS, we have intelligence, we have everybody who ought to be working together, like Mr. Daniel said. This is not a one-man show. There is no show here. There is no show for the Air Force. There is no show for the Army. There is no show for those on ground. It is not a show. Nigeria is going through a whole lot. Lives are being lost. On top of this pandemic, within the time of the pandemic, if you remember, there were already security issues of people going into the villages and killing farmers, burning up rice farms, ransacking farms, and right now the price of food has gone up, which also escalates to the issue of continuous insecurity, and the cycle continues. And as a nation, is it not about time that even when the NSAR, the youths, the voice of the youth rose up, a nation should sit down and take stock of what she has been doing in the last 10 years that has not been successful.
Okay.
Nigeria fought in ECOMOG. So where is ECOMOG in this war? We need our own ECOMOG coming to help us because Nigeria has paid the price in keeping the security of other nations. We got to bring an end to this issue. It cannot be perpetuated.
We understand Major General John Enenche needs to run, but we do thank you for your time, General Enenche. But, Mr. Daniel, what do you think we're missing in all of this? Because, I mean, Nigerians see all these things going on with our security agencies, and they have huge questions. What do you think it's missing in all of this?
You know, in all sincerity, I believe very strongly that we're not doing justice to just the army if we begin to focus on them.
Yeah.
On all the security agencies.
Mm-hmm.
I'm sure the Major General is a fine gentleman. For him to be a Major General, I mean, I'm sure he's qualified to do so. And he has to also understand that matters like this is not personal. He's a spokesperson responsible for an institution, and he takes and bears the responsibility when he's at a program like this. But having said that, the security architecture of Nigeria is beyond just looking at what the military itself is doing. We have to go back to the fact that the government of this country is responsible for the state of the country.
That's it.
And the challenge that we have, there's a deficiency in our leadership across board. And what do I mean by that? Every government always thinks that when you complain about what is happening, it becomes, it seems as if it's them, The issue of security has been before this government.
That's it.
The challenge we've had in this country has been before this government. But the thing is, every government has the opportunity to right the wrong. And if you don't seize that moment, you're like every other government. And so the responsibility falls at your table, whatever is happening at a time like this. Now, the sincerity and openness, I think that the pandemic gave this government an opportunity, you understand, to win the hearts of people, to gain the hearts of people, and to regain its credibility between the people. And the reason why I'm saying that is that the pandemic, the COVID pandemic, it was clear that before they started thinking about lockdown, it was obvious that any right-thinking government would know that the citizens all across board would be faced with poverty to another level. We saw what had transpired with the looting of all the palliatives. You would have thought that there was enough time to execute distribution of each and every one of these palliatives as soon as you receive them, because people have been locked down for such a long time. That should have been a priority by government to ensure. We've seen how much money was spent, was put in the budget. We've seen how much money that COVID-19, the committee of bankers, and what they put together. It's enormous. We should applaud them for putting something like that together. But how that was utilized is totally different. If you would appease the people in time to just make sure that at least they were taken care of within that period, we wouldn't have had, the kind of explosion that we have today. So it's a simple case of you don't work in isolation. You look at the broad situation. Why do we have insurgency in the first place? Again, it's poverty. It's poverty ravaging the entire northern part of Nigeria. And I think that people need to take responsibility. I think governors of the states should take responsibility. It's not just these agencies. I think the leadership should take responsibility across board. I believe that Nigeria has an opportunity to be able to change things. The people of Nigeria are constantly asking questions. And what is sad is when security agencies come and tell you for security reasons, we're doing the same thing we've been doing for 20 years, 30 years. If you're a spokesperson for an organization, then you must have the liberty to be able to express and create confidence in the people. And I don't think that has been achieved so far. So we need to be able to look at this very squarely, that the challenges that we're dealing with now as a nation is that the government must create. I see this laudable thing about investing in infrastructure. And we're borrowing so much money to do this infrastructure. But you are not creating commerce in all of these areas that you're putting the infrastructure so that it carries value. Or for instance, we have train tracks all across the northern belt, but we don't have commerce around those areas. So the things that you would expect that will begin to pay back the loan that you've taken, it's not in existence. So you're just plunging us further into debt to the point where the poverty, it's a bad situation.
We're coming to those sectors, economy and then, politics. But we'd really like to thank you, having time to come out and discuss all of this issue. But just before we sign everyone away, let's quickly hear from you, Professor Dikwa, and that is your parting thoughts on what you want to see in terms of security in 2021. Briefly.
Great. I like the word used by the lady there. It's an insult. It's an insult to to have allowed this thing to linger up to 11 years. Imagine this thing was not just 11 and it was not accidental. Imagine in the first, between 1999 when we returned to civil rule and to that, it was a government that disarmed our military from the northeast, moved the weapons to the south. Some of them even exploded in Lagos barracks. And that time, it was that time that the assassins got emboldened. And nobody was queried for that. They came through Monguno, northern Borno State. And therefore, I believe that the federal government should be able to
Professor
listen
Dikwa,
to the governors
apologies, we need to go to break, and it's a commercial one at that. But we do thank you for your perspectives, Professor Dikwa, Mrs. Julia Benite, and Mrs. Marla Daniel. Thank you all for coming on today.
Thank you for having us.
All right, the year 2020, year of pandemic. We'll be back in a moment. Stay with us. Welcome back to 2020, a year of the pandemic. Well, now we turn to politics, and we've got some gentlemen joining us. Ismail Ahmed is the Senior Special Assistant to the President on Special Intervention and National Youth Representative of the APC, joins us via Zoom. We also do have Dr. Saidu Dukawa, Senior Lecturer, Department of Public Admin, Bayero University, Kano. Thank you for joining us as well today on the program. Let me start with you, Dr. Dukawa. Concerning how this year has panned out politically, what are your impressions?
Yes, the order not clear.
Can you hear me, Dr. Dukawa?
Hello?
We can hear you, but can you hear us?
Yes, I can hear now.
Okay, well, talking about how politics or the politicians have conducted themselves this year, 2020, given all that we have gone through, how would you assess them?
Yep, of course, it's very noisy. It's very noisy. I don't know whether you can hear me properly.
Well, we can hear you well here.
There is a lot of echo, a lot of noise, and my voice is coming back to me.
Okay, well, we'll give you a moment, and then I think they'll just attend to you, and then we'll come back to that. But let me get back to Ismail Ahmed. Ismail, I don't know, can't ask you to give yourself a pass mark in this one, because, I mean, your party is in the thick of things. But, well, would you say, clearly there might be areas of improvement, but from what you have heard, there are lots of people who think otherwise, but give us your impression how things have panned out from leadership this year, 2020, in the country.
Well, thank you very much, Chamberlain, and Merry Christmas and Happy New Year in advance. And thank you for having me. And I'm sorry I can't join you in the studio. I would have loved to do that on this Christmas and this New Year's Eve. 2020 has been a difficult year all through, both I think health-wise, politically, and economically for every country in the world. Nigeria was no exception. But we had to, speaking politically, we had an issue in the beginning of the year, which was towards the middle of the year, that you are well aware of in our party. But we were able to stave off the problems, and we picked up, and we moved on. We got into Edo. We hoped that we could win, but we had some internal house cleaning that we needed to do.
Hello?
A lot of mess was already created. Hello, can you hear me?
Yes,
Go ahead.
Ready, I'm on mute.
Ismail, that's for you. You can go ahead, Ismail.
Can you hear me?
Yes, go ahead.
So please, because
so
there's no network.
There was a lot of internal rumbling within our party at the beginning of the year, towards the middle of the year, towards June. Before, of course, we had a NEC meeting that brought us on board as the interim committee, and soon after that, we went into gubernatorial election, and we went because we already had an internal problems going into the election. We had a governor that was among our party who defected to the PDP, and we unfortunately lost that gubernatorial election. But we believe that we could have won it. You know, we won a couple of few gubernatorial elections in Edo in the last 2-3 cycles. We lost this one. We took it in good faith. The INEC brought some improvements in terms of electioneering management. But we braced up. We moved on to Ondo, and in October, and we won Ondo in the landslide. We also won a lot of by-elections of state assemblies and senatorial elections as well across the country. So politically speaking, it hasn't been a very bad year for us. It's a bit balanced, but economically speaking and security-wise, because of the pandemic and so many other things, we've had some issues. But our government is on top of the game, and we're trying to move on to make sure that we nip every situation in the bud. And 2021, hopefully, it's going to be a better, more prosperous year, both in terms of economy and politics, God willing, and generally the polity as well.
Mr. Ahmed, seems to be a lot of optimism, for 2021. But looking at what played out in 2020, also the Edo state elections, are you really saying that, all is well and good with the All Progressives Congress members of the party nationwide?
Well, there has never been a time in any political party, especially the one that is in power, when every member will tell you that he's absolutely fine with what is going on. Of course, we have issues. That's the reason why there was a caretaker committee in the first place on June 25th of this year when we had a NEC meeting. Of course, there are issues. We know that, a lot of issues from different quarters in different states. But we moved into action. We sent different committees for reconciliation. There was reconciliation, but of course, you would always find recalcitrant members who are not willing to see eye to eye with their political adversaries for whatever reason. You would find people that would find it easy to go to court and litigate issues that are absolutely unnecessary. You would always find those people. This is a 15 million member party. You can't say every person among the 15 million people who are members of this party would be absolutely happy with what's going on at whatever level, be it at the unit level, at the ward level, at local government, state, zonal, or the national level. You always find people who would be disenchanted with what's going on, or who would want certain things to go their way, and it wouldn't go their way. And they would probably want to look for other avenues, either to defect, either to pursue legal avenues to make sure that so there will always be that. So you can't say everybody is happy. No political party would make everybody happy. But to a large extent, we are trying to reconcile a lot of aggrieved members that have valid reasons to be aggrieved and try to see how we can come together, because this is a human organization and there's bound to be a lot of frictions here and there. Let's see how we can come together and be able to sort out some of the issues that can be sorted out. And the ones that cannot be sorted out because emotions have gotten into it, passions have gotten into it, and there's a lot of things that are invested in it. Well, so for some people, there's absolutely nothing you can do.
All right. Well, we do have Mr. Jibrin Okutekpa, Senior Advocate of Nigeria, joining us via Zoom as well. Good evening, and thank you for joining us today on the program, Mr. Okutekpa. We'll come to Dr. Dukawa very soon. But Mr. Okutekpa, we've just heard Ismail talk about how he thinks things have panned out politically for his party in the country. Do you share the same view?
Well, Chamberlain, thank you for the privilege. I hope you are hearing me.
Yes, I can hear you.
To join you. I'm not a politician, let me confess. And so it's difficult for me to share his view I think in Nigeria, politicians across political divide seem not to believe in democracy, and politics in Nigeria is built along individual rather than the sovereignty of the people. And so I do not share his views. The crisis you have up and down in all the political parties in Nigeria is as a result of lack of internal democracy in the Nigerian political parties. And so across the political parties from north to south, east to west, you see what appears to be authoritarianism, and His Excellency P2B is seeing me and I'm seeing them. I think Nigerian politicians need to be born again to embrace democracy. What we are witnessing in Nigeria is not democracy. It is a reminiscence of a military dictatorship in civilian garment. And so there are no internal democracy. And they are carrying over even this undemocratic culture to even our courts. And so it becomes a do or die affair. We cannot talk about democracy in Nigeria, unfortunately. I do not believe that what we are doing is democracy. Is who has the piper dictate the tune. So it's the government of the bourgeoisie for the bourgeoisie and for the bourgeoisie. So the ordinary Nigerian people cannot, in clear conscience, say we are participating and having participatory democracy, the kind you have, where Attorney General of the United States of America will tell the president that you are wrong. We rake so many false allegations as a result of partisanship. So I do not share the conscious optimism of Nigerian politicians that what we have witnessed so far is democracy. So unfortunately, because I'm not a politician, I do not believe that we are being sincere to ourselves. You know, unfortunately, that's my feeling.
We didn't even introduce you as one, so we're even on that one. But you know, that those who also will say, look, all of these things you've highlighted wouldn't have been possible without lawyers, the judiciary, playing their part, because they are an important arm of democracy.
Chamberlain, I'm not too sure whether you are hearing me, but if you are,
I can hear you.
Are you hearing me?
Yes, go ahead, please.
Well, if you have consistently read my write-up, and I have said time without number, that in most cases in our courts, we have judgment devoid of justice. And what Nigerian people look for is justice. I have criticized our over-reliance of technicalities and what I call the roadblocks that we have set by the legal profession to attainment of justice in Nigeria. And in most of these places, you see that what you see in our political cases are political judgments that hardly take into account with respect the sovereignty of the people. And so when we go to high technicalities of propounding theories of law that does not advance democracy, and then we now have what appears to be rubber stamping of a winner of all elections will always be the one that wins. Only in few cases, you see somebody who is declared winner by NEC loses the election. So I agree with you, and I've said it, and I will say it here without being apologetic to anybody, that Nigerian politicians must leave our judiciary to function. If we don't allow the judiciary to function, then unfortunately, we're heading towards a crisis situation. The judiciary too must also not allow themselves to be manipulated. So I'm a Nigerian, and I speak my mind, and I tell you with all respect that yes, the judiciary, the legal profession cannot be less blamed in the shenanigans that we have in our society. Indeed, it's Nigerian problem. And I see that when we are talking about restructuring, power shift is attitudinal. We are looking for, is this part of this society that's supposed to be president? Not because of performance, but what we can share from the national treasury. So I agree with you that the legal profession cannot be exonerated from the undemocratic posture we have in our society. And so, but how many people will hear me? I wish that His Excellency P2B will gather Nigerian politicians together and become born again, respect the will of the people. And the reason why we are seeing what we are seeing is because there are no sanctions for infractions of our electoral laws, for infractions of democratic principles. There are no sanctions. So there is impunity. That is why NCDC that started peacefully was hijacked by political, I'm resisting the temptation of what is operating in my mind. But Nigerians were used against Nigerians to stop a peaceful movement. So my take is that for us to have democracy, the kind that was described by Abraham Lincoln as government of the people, by the people and for the people, we must then go back to drawing board, become born again.
All right.
In terms of our character, in terms of our orientation, in terms of our belief, and we must have leader who is interested in the welfare and interest of Nigerian people.
We hear you. You've called out Mr. Obi a couple of times, but we'll get him to respond much later. And Dr. Dukawa as well. But the judiciary, as you say, they cannot claim to be unwilling participants. We will be back in a moment. Stay with us.
Welcome back, and we're discussing politics at the moment. We've been talking with our guest, Mr. Ismail Ahmed, also Dr. Saidu Dukawa, and indeed Jibrin Okutekpa, Senior Advocate of Nigeria. Let's go over to Dr. Dukawa right now, and hoping that you can hear us. A few of the things that we had the Senior Advocate talk about was that there is a lack of internal democracy in some of the political parties, if not all, in Nigeria, which is also affecting the leadership. And he says that perhaps it's high time that politicians became born again. What's your thought on perhaps the politics that have played out in 2020?
Yes, of course, I agree with him in total. You see, certainly it's not just the issue of internal democracy that is lacking, but also going by the elections that took place in Edo, in Ondo, among other places, we see that all other elements in the Nigerian politics are still very much with us. Money politics, the use of thugs, the handling of politics as a matter of do or die generally were very visible. And also the tendency of a sitting governor to win elections. When we consider what happened in Edo and Ondo, clearly it's a case of incumbency factor, that whichever party the governor belongs to, he will win his elections. And so also in places where local government elections were conducted, the tendency of winner takes all. Okay, that in each state that local government elections were conducted, the ruling party in the state swept all the seats. Not even a councillor seat is allowed to go to an opposition party. All these illness are still very much with us. I hope we are together.
We can hear you.
Yes, because at my end, it's very noisy, really.
All right, let's go over to SSA, to the President's Special Intervention. Mr. Ahmed has joined us via Zoom in Nairobi. And this is with regards to perhaps learning from what Dr. Dukra has said. The elections, I mean, we have now second term the head of the Independent National Electoral Commission who has been appointed. And we're also gearing towards an election in 2023. But we're also seeing some political dynamics play out this year. There's also been the talk of the Southeast for presidency. These have been issues that a lot of people have talked about. There's also that of the electoral amendment, which a lot of people are hoping that, you know, it will be passed this time around. What can you tell us as to what you think this government is planning? And this is ahead of 2021.
I think we lost him there.
Okay, hopefully we're going to get back to him. But perhaps, Dr. Dukra, if you want to take this.
Uh-huh. Yes. Come again?
Okay, just about the electoral reforms. I just wanted to know if you are optimistic that we will have a reform that we can trust to the point where we can indeed trust our elections at the end of the day.
Of course we can. It's a matter of determination. It's a matter of the will to do so. And we have done it in 2015. So we can do it again. We can have an election of our dream. So it's a matter of determination of stakeholders to come together, to form the necessary alliances, to pursue the necessary measures, and to mobilize the people as much as possible. And so long as we have the clear direction of what we want, how we want it, and we go in unison, certainly we can. But as at now, it's like a lot of the gains of 2015 have been lost in 2019 and up to 2020. And we really need to sit up right from 2021 if we want 2023 to be better for us all.
Let me come to Mr. Jibrin Okutekwa, and this is with regards to the judiciary's play in this. Just like previous years, we've seen the conversation of restructuring crop up again in 2020. I mean, what do you think? Where are we headed for 2021? Do you see all parts, different parts of the country speaking with one voice as to the way forward for Nigeria?
Well, thank you, Millicent. I do not know whether we can speak with one voice. We can only speak with one voice if we have the love for this country, we have the nationalism, we have the patriotism. We believe in a project called Nigeria. Or now, if you watch carefully and go through the news that I'm making the round, there is tendencies for every politicians and political class to engage in over selfish protection at the expense of Nigerian interests. And I believe that the only arm of government that should have put the political class in check and do so effectively if there was no interference or if they did not allow themselves to be interfered with, would have been the judiciary. But unfortunately, when in some cases, when Nigerians put their hopes so much so in that arm of government to deliver, what you get becomes justice that is rooted in technicality rather than the merit of the matter. And so I have advocated on a series of occasions that our justice system in our electoral system needs to be seriously looked into. A situation where a loser of an election hardly gets justice in our courts, not because he or she does not have a good cause, but because there are legal obstacles put on the way of losers. For instance, why do we insist in our electoral jurisprudence that public document duly certified by INEC must be tendered by the maker? Why do we insist, for instance, that you must call polling unit by polling unit agents where you know that Nigerian politicians will interfere and will prevent agents of polling units from coming to testify? Why can't we borrow a leaf from Kenyan experience where you spend less time calling legions of witnesses and the Electoral Act says you just have 14 days to prove your case for presidential election? So I think that the National Assembly, Nigerian people, the judiciary, the executive, and the legislature need to come together to believe that we need to give ourselves electoral justice.
We'll take it from there.
Justice can only be given by changing our attitude.
We'll take it from there onto
Nigeria, I obey in preach rather than in obedience.
Well, you did reference Mr. Obi more than once, so we'll take it from there onto him. But we do thank you for talking to us today, Mr. Jibrin Okutakpa, Senior Advocate of Nigeria. We've also had Dr. Saidu Dukawa, Senior Lecturer, Department of Public Admin, Bayero University, Kano. Thank you for your time as well as Ismail Ahmed, Senior Special Assistant to the President on Special Intervention and National Youth Representative of the APC. We will be back in a moment. Don't go away. Welcome back. Well, yes, continuing with politics. And now we've got Mr. Peter Obi, former vice presidential candidate of the PDP. He joins us via Zoom today. Good evening, and thank you for joining us. Well, I don't know how much of what you heard about the previous guests who have different perspectives. Some did allude to they say, look, our political system is largely dysfunctional. Something needs to change. The political structure, the politics is transactional in nature, and even the polity needs some fundamental changes. So could you start by telling us what your impression is first about the political system or structure that we operate in the country?
Well, Chamberlain, can you hear me very well?
Loud and clear.
Okay. Well, let me say that I agree entirely with Jibrin in his position. The politics as it is today is very, very transactional and lack the essences or the qualities you can use to define democracy as government of the people, by people, for the people. I agree entirely with him. There's need for us as a nation to decide to practice genuine democracy, or at least some semblance of it, which is not there today. But where I differ a little bit with Jibrin is that it is not just the political class, but the people as well. The people need to be part of this change, because what you see happening here in Nigeria has a lot to do with what I call the complacency of the people. The people think you can leave this in hands of the politicians. But this is what affects them. So they have to demand that the right things happen.
How? Okay, go ahead.
I was going to say that a lot of the times the people are just watching. They're trying to live their lives. They're trying to go work day to day. Essentially, they're trying to, I think, more or less survive on a daily basis. So putting this responsibility on them, what do you expect from the people, really?
Well, this affects them directly. This affects them directly because the actions of the politicians, the actions of we, the politicians, affects them. It is about them. So if you have a situation where somebody's action or what is going to do while in office will affect you, you should be committed that ensuring that the right things, first, that the right people are voted into office. As you can see, what is happening in our country today is because we have the wrong people in office. We have people who are incompetent. We have people who lack capacity. And that is why we have become what we are today. If you look at every day we shout about being the poverty capital of the world, it is because we have incompetent leadership. And the only way to deal with it is that the people who are directly affected listen and do the right thing by ensuring that the right people who are competent, who have the capacity, who have what it takes to turn this place around, are voted into office. Examples you've seen me do so many times referring to what is happening. Look at our country, what is happening now. All the reports you see on December 22nd, you saw the Financial Times editorial saying we are becoming a failed state. And when you look at indices of what a failed state is, you will agree with them because we seems to be running out of control. We are kidnapping of all sorts is that happening all over the country. We're talking about what happened in Katsina. Look at what happened in Imo now, where a Cali bishop is kidnapped in the heart of a Christian state. So you can go on and on. You have a situation where the World Bank report this year, all the reports have shown that we're becoming physically unviable. And you could see it yourself happening everywhere. We become the highest in drug prevalence, 14.8% against the average of 5%. We've overtaken India as under 5 mortality. You can go on and on. So it's affecting the people. So the people must sit up and say, how do we start reversing this trend? And you can only do it by competent leadership that have the capacity to deal with the situation.
But that's another question, getting competent leadership. Isn't there an avenue where politicians can advise each other? And this is looking at the best interests of the nation and everyone in it.
Come again.
Isn't there an avenue where politicians can advise each other in the best interest of the nation?
No, it is impossible when you have people who are engaged in transactional, politics. When everybody's about sharing, there's no avenue of production. As you can see, our country is not productive. That is why our economy is not growing. Everybody's about sharing. Nobody's creating wealth. Nobody's creating anything. That is why we have a system that is not growing. While other nations are working hard to pull itself out of poverty by growing the economy, ours is going the other way around. So there's no way you can have, when people are sharing, they don't have the time to think about production, about advising each other, because it is like Jibrin says, everybody is selfishly involved as what am I going to grab out of this system? But I still continue to blame the people who watch the sharing go on and participate in it and are celebrating the criminality. Go around all over the place now. The people are hailing, the people are calling good names, giving good places, even in place of worship and everything, are those who are stealing more money. They're the ones being celebrated and giving us of award and also of chieftain titles and everything.
So some of what you suggested, the changes that can happen given our structure, happens every 4 years. So does that then suggest that in the meantime, until that time, there will be nothing the people can do?
Chamberlain, if people know that in 4 years, they will be changed because they're doing the wrong thing, they will be able to do the right thing while in office. But because I know that if I steal money and share it to the people after 4 years, they will still keep me in office, I will continue to do it. Chamberlain, look at a very simple example. When I talk, people say about China, about this. If you look at what has happened, say, in Vietnam today, we started this so-called as present Third Republic in year 1999. Within that period, from year 2000 to year 2018, Vietnam have put over 50 million people out of poverty. They have maintained an economic growth of about 6%, about 7%, while their population was growing at 1%. Our own situation, so they have 6% gap. Because of that now, even in this COVID situation, they are not one of the countries that have fallen into recession because they have had an economy that has been on growth for over 20 years. While in our own case, within this period, by 2018, we've overtaken India as poverty capital of the world. In a situation where we have now more people living under poverty than India and China combined, and for the World Bank report, about 11 million is going to be thrown into this after this recession, and we're not talking about it. So for me, we need now to resolve that all the coming elections, only competent and those with capacity will be elected. You know, and if people know that is going to happen, some of them will start changing.
Oh, just wondering, I mean, you've held these views of yours for a while now, and then you've also been a governor for 8 years. You've held several other positions. One wonders...
Can I hear you, Chamberlain?
Yeah, can you hear me now? It appears as though you might need to unmute if you mistakenly muted it. Can you hear me now? Oh dear, it looks as if it's frozen on us as well. Okay, so I think we'll see how we can start that. I'll just
But he's also launching us into our next segment, and that's talking about the economy.
Yeah, so there you go. We'll be back in a moment. Join us again. Welcome back. It's our concluding moment with Mr. Peter Obi. Well, I was going to ask you, having been in leadership position previously, and you've also held these views of yours for a while now, but how much of discipleship or how many disciples have you made of these views such that we can have such people also occupy positions of leadership as you did?
Well, Chamberlain, the only thing you can do is to continue preaching and pleading with people that we're on a wrong trajectory. Where we are today, we are traveling on the wrong direction. We're not going to be led out of our problems if we continue in the direction our compass is not pointing to the right direction. So it is important that the people understand that unless we do the right things, nobody, tomorrow success will only be achieved by today's sacrifice. If we don't sacrifice and do the right thing, if we continue to build a government based on consumption, sharing and consumption, where people think that you can continue to borrow and consume and think that tomorrow one magic will happen, it will not work. All we're going to do is to throw more and more people into poverty. And the consequence is that you could see it, our economy is not growing to be matched to the population growth. Things are getting worse. If you look at it, just simple thing today. So mine is to preach, is to beg people to understand. We need to do the right things. We need to create opportunities for job so we can be able to have people employed, grow our economy. What makes a country is growth of the economy. And that's why you see all the groupings, whether it's G7, G10, G14, whatever they call them, G20, is by economy. And that is very simple. Have a country that is secured. We're talking about inflation, fighting food inflation now. If we have security, people will go back to the farm. The same thing happens if we focus on ensuring that we support SMEs to grow the economy. We create jobs. I was talking to somebody yesterday who told me that only 20 million Nigerians pay tax. I said because you have 100 million that is living under poverty. Ideally, in an economy, a population of 200 million, Chamberlain, 100 to 120 million is supposed to be active and productive. And with that, you have at least 60 million paying tax. And it is not a rocket science. You could see it. China, with a population of 1.4 billion, have 850 million people employed and productive. That's 60%. Indonesia, with 250 million, have about 140, 150 million employed. That's a simple deduction that you have 200 million, so you need about 100 to 120 million to be productive. And if you have that, 20 million people that are paying tax today will probably triple to 60 million. You get more revenue.
Well, that
every day.
That takes us into, well, we have to thank you very much indeed, Mr. Bitobi, former vice presidential candidate of the PDP. So, Millie, that takes us to the economy.
You're quite right. I mean, it's really the final segment, but it's also one that has affected everything, everything essentially. Yep. But, for the second time, in 5 years, Nigeria went into recession, high inflation, foreign direct investment dropped, borders were closed, and, there was also the drop in agriculture. It really was a major setback also due to the coronavirus pandemic. But some people argue that perhaps the COVID-19 pandemic wasn't the major thing that affected performance. But let's introduce our guests who are joining us for this final segment.
Well, yes, indeed. We've got Dr. Abubakar Alkali, public affairs analyst, joining us via Zoom from the United Kingdom. We've got Dr. Yabo Masha, Presidential Advisory Council member, will be joining us via Zoom from Washington, D.C. But we'll get all the others in. But take a look at this report now.
We're hopeful that this
pandemic will be limited in time. So if it is an average of 3 months, we should be able to still close the year with a positive growth. But if it goes longer than that, 6 months, 1 year, we will go into recession.
A statement made earlier this year by the Minister of Finance, Budget and National Planning, predicting that Africa's biggest economy will go into recession before the end of this year. Now the reality is here. 2 consecutive quarters of shrink in real GDP numbers. Owing to the impact of the coronavirus pandemic on the economy, which has caused a significant decline in oil prices and revenues, as well as a huge cut in production, which currently hovers around 1.67 million barrels per day, Nigeria is forced to look into other sources of revenue, like tax returns and the non-oil sector. This recession does not come as a surprise to analysts who predicted that the country will go into a recession, the second within the last 5 years, signaling an end to the 3-year trend of low but positive real growth rates recorded since the 2016 recession. With the country's inflation accelerating to a 14-month high at 14.23% in October, and cumulative GDP in the last 9 months of the year at minus 2.48%. The question is, how does this affect the average Nigerian?
There is no way the consumption index is going to grow or was going to grow because the disposable income has been eroded. There was no way you were going to have a positive investment index because the country has been experiencing what we call business climate hostilities.
With the results showing how badly hit the Nigerian economy is, many are hopeful that the government will develop a more practical approach towards building a resilient economy going forward.
Welcome back. Now time to talk economy, and we've got Dr. Abubakar Alkali. He's a public affairs analyst joining us via Zoom from the UK, as well as Dr. Yabo Masha of the Presidential Advisory Council. She joins us via Zoom from Washington. Well, thank you both for joining us today on the program.
Thank you.
Thank you for having me. All right. Dr. Masha, let me start with you. The economy, the different diagnoses out there in terms of where we are currently, where we're coming from, and how we should proceed. Let's get your impression in terms of where we are at the moment. You could predicate it on the budget projections, if you will.
Okay, thank you very much.
Go ahead.
So thank you very much for inviting me to this very important presentation and interview. In terms of where the economy is, this is 2020. It's the year of COVID-19, and it's also the year in which we have this substantial decline in oil prices and also in the volume too. So it's not the best place to be, but we can take solace in the fact that this is something, the downturn is driven by the external environment. Both factors are beyond the country's control. So we are in a downturn, we are in a recession. We are waiting to see the data for the final quarter of the year, and it may or may not be better than the last 2 quarters. I think the very last quarter, quarter 3, is showing an upward movement. The contraction is less than what we had in quarter 2. So that's fine, but we really can't say. But the best guess is that with the disruptions from the SARS, NCDC protest, and some of the security challenges we've had in the past few weeks, it's not too clear whether this last quarter will be better, and then we may very well have a full year of contraction. But the good thing is that is really the contraction, which was supposed at least forecast to be 6% contraction in the early part of the year, is being revised up downwards to 4% maybe So that shows that the economy has been more resilient than was initially thought. And then we wait and see what the numbers say and how the next year's budget will improve the outcome.
We'll look at some of those numbers in a moment, but we can't forget Professor Uche Owaleke, who is a professor of capital market, Nasarawa State University. He's also the president, Capital Markets Association of Nigeria. He joins us from our studios in Abuja. Good evening, Prof, and thank you for joining us this evening. But let me just follow up on some of the figures that Dr. Marsha pointed out before I bring it back to you, gentlemen. Well, looking at the figures, Dr. Marsha, well, yes, COVID did hit, but we also did see that even the figures from 2019 did show that much as we projected a strong GDP growth rate of 4.5% in 2019, the ARGP, according to the NBS report, did indicate that in May, the economy only grew by 2.01%. And as a matter of fact, AFDB projected that we're only going to grow for 2.3% in that same year of 2019. So we were not even that buoyant coming into 2020. So we cannot blame it on COVID, can we?
Well, this is, I think we're talking of 2020 roundup. So I'm focusing more on what happened in 2020. Definitely, the economy in the past, I will say, since 2014, actually, when we had that first steep decline in oil prices coming out of a very huge boom, which resulted in oil prices of over $150. So the economy has been on an extended period of slow growth, and then recession in 2016, 2017. And 2018, 2019 was more like a very slow recovery of the economy. Now, there are important fragilities in the economy that means that there are no quick fixes. The best is that the economy will grow at a slow pace whilst the necessary reforms are going on, and then in a period, more in the medium term, like 3 years, then you can start seeing growth of 5-6%. But yes, you are right. The economy has been on a slow growth. 2.3 is less than the population growth of 2.6, and that could very well persist for maybe another 1 or 2 years before we can really see that big push. Part of the reasons for that is that, to a large extent, we're still dependent on oil. There's a lot of structural transformation taking place in the non-oil economy, but they are going to take some time to work their way through the whole economy. So for now, we're going to be exposed to some of these instability in the market.
Thank you, Dr. Masha. Just before we come to Professor Owaleke, to Dr. Alkali, and this is a question I'm asking based on, perhaps, let me rephrase it. In your estimation, what would you say was the perhaps major factor that affected the performance of Nigeria's economy in 2020? This is to you, Dr. Alkali. And do you think that the Nigerian government handled it well enough in 2020?
Thank you very much for having me. I think to a large extent, you cannot talk about the economy in 2020. By and large, you cannot talk about many other things without reference to coronavirus, COVID-19 pandemic. And I think one of the key reason why the economy was sluggish, was slow this year is largely attributable to the pandemic. However, I also think that, over dependence on a commodity, on one commodity, a unique commodity economy is very, very vulnerable unique commodity, of course, in the sense that the economy is largely dependent on oil, and any oil shocks, any fluctuations in oil are likely going to impact on the economy. So to a large extent, I think what has happened should be another eye-opener, another opportunity for us, to put our acts together, because there is really a very, very important need, very urgent, if you will, very urgent need to diversify the economy away from oil. Of course, government is talking about it. Whether the right structures have been put in place, that is another different thing entirely. There is need to diversify this economy. And in this diversification, I think there is need to focus on specific areas. Because I don't think diversification in the sense of saying, okay, we are going to diversify the economy around 100, 150, 200 different items, I don't think is reasonable. We need to diversify on a single, on specific routes. What am I talking about? For example, if the government can pick one or two commodities, one or two items. Of course, the diversification I'm talking about is largely on the agricultural sector. Government is talking about, diversification towards agriculture. Okay, fine. Now, within agriculture, where are we going? If you ask me, and yes, you did ask me, I think it's better within agriculture, we pick a particular commodity. We can say, for example, textile. Our diversification is going to focus on textile. And in this diversification, there is need also to look at appropriation, to look at budget, because I think the conventional method of budgeting needs to be reviewed. If we are diversifying towards a particular commodity, towards textile, for example, of course, there is need to invest heavily in cutting in revival of the textile industry. So let us say, for example, this chunk of the budget, this chunk of this budget, next year's budget, for example, is going towards textile industry, a large chunk of it. And then we pick on that route. Now, the second aspect of your question, whether I think government has handled the situation very well, to a large extent, I think government has put some measures in place, but there is more to do. There has been a lot of distraction, resulting from government's attention, to pushing in the effect of the pandemic and other areas. So I think government, in handling this kind of issues, this kind of random issues, this kind of economic shocks, there is need for a sort of model. I want a situation where the government is, pushing on a particular direction, implementing a particular economic model. And as I said, looking at an area, a particular area, let us say, okay, look, we have, we are focusing our attention on textile. I think this is a realistic realistic focus. Let us say, look, we are investing this, chunk of the budget on the textile industry, and let us say, based on the model, based on our plans, we are looking at making Nigeria the hub of, textile in the next 5 years, for example. Let us set targets. Let us have benchmarks.
Okay, we'll take a look at some of those budget benchmarks and projections in a moment, but let's bring in Professor Owaleke and find out, Prof, what would your assessment be of where we are at the moment regarding the economy?
Yeah, thanks, Chamberlain. I would like to start by wishing the viewers Happy New Year. Let's not make mistake about it. that the present recession that we are in has been primarily caused by the COVID. Because if you recall, we were in a recession, before now, 2016 to 2017, again on account of collapse in oil price. But after 5 consecutive quarters of that economic downturn, the economy, came back to the positive territory, and for 12 consecutive quarters, experienced, positive growth. In 2019, for example, the economy was growing at an average of 2.27%. As a matter of fact, towards the last quarter of 2019, we recorded a growth of 2.55%, even though that, of course, was still below the population growth rate, about 3.2. But the point I'm making is that the economy was already on a recovery path. First quarter of 2020 was 1.87%. Then COVID came. The first index case in February. And in response to the COVID, we saw what happened, lockdowns, movement restrictions, and of course, globally, supply chains were disrupted. Demand too, became low to the point that we couldn't even sell our oil. So oil price fell. Okay. So all that now combined to result in the plunge that we had in quarter 2 of 2020 by as much as 6.10%. But of course, we also know that the government tried to intervene. We saw interventions not only on the fiscal side, but also in particular, from the monetary side. The central bank made a lot of interventions, including reducing interest rates on its interventions from 9% to 5%, granting 1-year moratorium, on loans, granting forbearance, and all manner of, palliatives. Okay, the federal government also scaled up its social intervention program. So what we now saw, accompanied with the gradual ease of the lockdown, we now saw a moderation of that contraction, in quarter 3, such that in quarter 3 we still had a contraction, but it was smaller than what we had in the first quarter, 3.60%. Okay, so the expectation is that by the fourth quarter, the contraction would, further reduce, and that was why, there's this optimism that by the first quarter of 2021, the economy will rebound and come back, in the positive territory. And the interesting thing too is that in all of this, if you like, economic downturn, we still had bright spots. We had bright spots, notably the telecom sector that continue to be in the positive territory, as well as the financial sector. You have had the recent news about our stock market. Our stock market, happens to be the best in the world as we speak in terms of return on investments, returning over 50%, on investments this year, and that's the best in spite of the COVID. But that's not to say that we still don't we don't have other sectors, many other sectors that are still in negative territory. But what's important is that if you compare quarter 2 of 2020 and quarter 3 of 2020, you would notice some improvement, even among those sectors that are still in the negative territory. And I said all these have come on the back of interventions that have been made. But it's also quite instructive to point out that the major challenge the economy faced in 2020 was not just the recession, but also rising cost of goods and services, or if you like, stagflation. So we had a case of recession. We also had inflation, on the rise, particularly coming from the food component, and that is why one would expect. I've always said that given that inflation rate today in the country is not necessarily driven by monetary factors, as the central bank has also confirmed, that the fiscal authorities, the government has a lot of role to play, and that role will begin by tackling insecurity that has been mentioned here. because insecurity has also led to the fact that farmers couldn't go to farms. And
Thank you, Professor Waleke. We've just been joined.
Using a silver bullet, addressing the agriculture challenge, for me, would be like using a silver bullet, to address the issue of recession and stagflation. Because
Prof, we're going to come back to you. Just a moment. We're going to come back to you. We've just been joined by the DG of the NCAA, Captain Musa Nuhu. Thank you for joining us. I'd like to ask, the aviation has taken its fair share of the toll due to the COVID-19 pandemic, and looking at how it's affected the economy, especially when there was the lockdown, which was in March, the airports were shut down. There was the resumption, July, local flights resumed, and then international flights. But we still have the coronavirus with us. And, there is 2021 around the corner. Country is still hoping for a vaccine. But in terms of how it hit the economy, do you see a recovery in the near future?
Thank you very much, everybody, and wish everybody a happy and prosperous new year ahead. I hope it's going to be much better than what we came through. Yes, certainly the aviation industries and the tourism industry was one of the most hardest hit sector globally. And as you rightly said, there's almost a global shutdown. In Nigeria, for a period of several months, we had total shutdown, and that significantly affected the aviation industry. And as we all know, the aviation industry, moving of people, goods, and services is a catalyst for economic growth and development. So when we shut down, a lot of businesses were significantly affected. Pre-COVID, the aviation industry in Nigeria was contributing approximately $1.7 billion to the economy, just about 0.5% of the GDP. And with the shutdown, we projected to lose the air transport industry in Nigeria, expected to lose almost $1 billion. So we're losing well over 50% of our contribution to the economy, which has significantly made life worse for the industry. The airlines are in very, very difficult situations. Just by their structure, their income is in naira, but most of their cost drivers are in dollars. And now the dollar rate has gone up. Not only has it gone up, it's even very difficult to get the dollars from the central bank because of competing demands from other sectors of the economy for this meager resource. They do their maintenance outside, they do their training outside, and that's the major cost driver. As per recovery, it's very, very difficult at this moment to project or predict what it's the recovery in the next 1 year. I estimate it's going to take a lot longer than probably 12 months for the economy, because the confidence to travel and the propensity to travel is going to take a while for people to really feel confident to travel. And in addition to that, in Nigeria, because of the difficulties faced by the airlines, they are operating at less than half of their capacity, which recently has, and because of the high demand, the air ticket prices have gone up astronomically, in some cases doubling. So it's going to be a rough and bumpy ride, but we've seen it's gradually coming back. But with the second wave, we don't know where the second wave is going to take us to. So it's really, really difficult for anyone to put his fingers and predict when we're going to get out of this. But it's certainly going to be a rough ride going ahead. And the government is doing its best to assist the industries with a palliative of 5 billion naira to the industry. And I believe more is coming. And the government is giving other facilities, such as single rate loans through the central bank to the industry, long-term rates, to help them recover. But certainly the aviation industry in Nigeria has been hit hard. Aviation, but now pre-COVID, had about 241,000 jobs. Out of that, it's projected 125,000 jobs at risk of being lost. It's quite a significant number of that have lost their jobs. And we expect more as the airlines and the other stakeholders industry trim down their costs. There'll be a lot more people who will lose their jobs. So that has repercussions on the overall economy, as people don't have, they lose their purchasing power, government loses income tax collection and all that. So it's really a very, very, very difficult situation for the aviation industry right now.
Well, Captain, is that to say that in spite of the budget that has just been passed by the National Assembly, it will not impact positively on the industry, the sector?
Well, budget is a projection. It's not a guarantee. We project what we think. And we are going into the second wave. I can tell you this year, during the first wave, we lost over 50, actually about 67% of our income. So with the second wave, we don't know. Nobody can predict how difficult it's going to be for the second. When are we getting the vaccines in Nigeria? When enough number of population will be vaccinated to really have control of this coronavirus? Yes, the budget is good. The budget looks very good on paper, but what is it on reality? The Nigerian economy has suffered. It's gone into recession because of the consequences of the COVID-19, also the crash of the oil price. So when the economy is not doing too good, the travel demand goes down, and that affects the industry. I mean, until other economic, micro and macroeconomic factors improve, the aviation industry is a good reflection of the state of the economy. As previous speakers have said, the Nigerian economy right now is in a very, very difficult situation. But we keep trying, we do our best. The government has been very supportive. The Ministry of Aviation has been very supportive. But the reality are the resources. And also the demand. It's the demand for travel goes down when the economy goes down. In Nigeria, you hardly have travel for tourism, vacation. Most of the travelers are either people going on business or government workers. And once the economy goes down, resources are down, those numbers come down, and that has impact on the industry.
Let's quickly take Dr. Masha, and this is getting your final thoughts on the issue. Yes. Okay, just asking, is there a very long road to economic recovery? How soon can we get out of this recession?
I think that some challenges. I think the first issue we should keep in mind is that even though the budget is a budget of recovery, and it's a budget that has allocated sizable amounts to different sectors and to programs that will aid the recovery. The major challenge with the budget is with the financing. So I think the projected amount to be financed is around $10 billion or thereabouts from borrowing. So if there is enough money, there's enough financing, and government can raise this financing from multilateral organizations, from other governments, bilateral donors, and also from the Nigeria domestic market, then that financing would be enough to at least keep the economy in a recovery mode. And I take the point that Captain Musa said, that a lot of the patronage of the aviation sector are business related and people working in government services. So we need to have we need to have adequate financing of the budget in order for the economy to start on a path of recovery. Because as government spends, the private sector is also able to produce, and the consumers then demand for more goods and services, which then goes into improvements in economic performance. So I think that's the main challenge, the financing of the budget. Now, but that's only for the short run. That is, where do we go from where we are? How do we improve on where we are, which is a shock mode. Long run, we're talking of how do we have a more diversified economy so that if there is a shock to oil or to any other economic parameter, we do not find ourselves in dire straits. And I want to note that indeed there is substantial diversification of the economy. The three sectors, the agri sector, that's the primary sector, the manufacturing and industries, and the services. Services probably has 40%, 45% share of GDP, and the primary sector and manufacturing, roughly 30-35%. So that's a pretty well-diversified economy. But the problem is that in industries, where the industries are producing goods that are very low value added and that are dependent primarily on imported intermediate inputs. And in the primary sector, both in agri, there's very relatively good agricultural production if you are looking at cultivation. But when you look at extension services to reduce post-harvest loss, for example, I saw a report that only 30% of what is produced in the farms get to the market.
All right.
The remaining get lost in the system because there's no storage, because rural roads are not well provisioned, and a whole range of even marketing of goods and services produced in the farms. And we also see that in our oil sector, there's we have crude oil, but refining the oil, for every barrel of oil, you only around 47 or 49% is gasoline. Okay. The rest is more than 216 products, industrial products. And a country like Saudi Arabia probably makes about $15 billion a year from petrochemicals.
All right.
Now, a very exciting sector. That's an area that in our oil industry, we see what is happening in the non-oil sector being replicated. We're not adding enough value when our refineries are not working. So all of these issues are the areas where we are focusing on. We need to focus on to really have a transformation of the economy.
Okay.
It's going to happen. There are many opportunities now with the Continental Free Trade Agreement and with all the other sectors that are coming up, all the opportunities opening up from the production that is getting out of China. So this is the time that we can get on the ground floor and use these crises, as it were, to take some very hard decisions that we have not been able to take in the past.
All right.
To incentivize production, we're talking of getting the exchange rate right.
Okay,
getting interest rate right.
Pardon me, but
inflation to that range that it doesn't serve as a disincentive to investment.
Well, I thank you, Dr. Masha.
Really, I mean, we'll have to end it at that point.
For things that happened the whole year 2020, it's quite difficult to discuss everything in just a few minutes.
Yes, indeed. So I have to thank you all for coming on. Dr. Yaba Masha is of the Presidential Advisory Council. She joined us via Zoom from Washington, D.C., as well as Dr. Abubakar Alkali, who is a public affairs analyst, also joining us via Zoom, but from the United Kingdom. And then Professor Uche Owaleke is of the Nasarawa State University and also the President's Capital Market Association of Nigeria, who joined us from our studios in Abuja. We also had Captain Musa Nuhu, Director General of the Nigeria Civil Aviation Authority. Ladies and gentlemen, thank you all for joining us today. And since it's the last time we'll see you this year, we just like to say Happy New Year to you all.
Happy New Year.
Thank you very much and Happy New Year to all.
And indeed, the best of celebrations for all our other guests that came in earlier on. Thank you so much.
Okay, so yeah, it's not all doom and gloom, is it? But,
no, it's not. There were some celebrations in 2020.
Yeah, and we had quite a number of them. So
yes, I mean, let's start. August, I think Africa was declared polio-free, meaning 0 cases of the wild polio virus.
That's right.
Nigeria was the last polio-endemic country in Africa and was officially certified free from polio after marking 3 consecutive years since the last case of wild polio had been identified.
Well, Dr. Akim Adesina is the 8th elected president of the African Development Bank Group. He was first elected to that position in May 2015 by the bank's Board of Governors at its annual meetings held in Abidjan, Côte d'Ivoire. He was re-elected in August to serve a second 5-year term as president of the African Development Bank Group by the Board of Governors of the bank.
And in June, we had the president, Muhammadu Buhari, who nominated Dr. Ngozi Okonjo-Iweala for the post of WTO, World Trade Organization Director General. She's the finalist for the position. However, the U.S. representative at the WTO took to the floor to insist that South Korea's candidate remained a contender and that Washington will not recognize Dr. Okonjo-Iweala as a consensus candidate for appointment as DG.
We all remember that. But then Anthony Oluwafemi Olasheni Joshua, I didn't know there were that much, claimed a stunning knockout win over Kubra Pulev at Wembley Arena to retain his world heavyweight titles. He proudly associates his roots to Nigeria, and his win got to the heart of many in the country, including me.
Right. And sadly, to some of the passages of this year, in February, Victor Abimbola Olaya OON, also known as Dr. Victor Olaya, died at the age of 89. He was a trumpeter who played in the high life style.
Yeah, in April, Richard Akinjide, jurist and the former Minister of Justice, died at the age of 90. He served as the Minister of Education in the First Republic and the Minister of Justice in the Second Republic.
Also in April, the late Chief of Staff to the President of Nigeria, Abba Kyari, died. He was aged 67 and died after contracting COVID-19.
We also lost Senator Abiola Ajimobi. He was elected in 2003 as a senator representing Oyo South Senatorial District. In 2011, he contested for governorship and was elected governor of Oyo State in a closely contested vote. In June, he was confirmed to have COVID-19 and was announced dead on the 25th of June.
So the next time I'll be here, it will be 2021. We can finally say goodbye to 2020.
Gladly so too. And we hope that wherever you are, whatever you do, we hope you keep it simple, safe, and happy. Happy New Year to you all.
Happy New Year to you, and thank you to all the team, production, staff, management of Channels Television. It's really been a year.
So, on behalf of all of us, I'm Chamberlain Osor.
I'm Millicent Walker.
Good night.
Good night.